Two, one.
Hola, muy buenos días, muy buenas tardes
Hello,
para
good
todos los que
morning
nos
and afternoon
acompañan
for
para
everyone
conmemorar
joining
los 10
us in
años del
commemorating
Med
the
Safety Week.
10th
Mi nombre es
anniversary
Diego
of
Salas,
Med Safety
director
Week.
del
My name is
Centro de
Diego Salas,
Regulatorios para
Director of
FIFARMA, la
Regulatory
Federación
Affairs at
Interamericana de la Industria
FIFARMA in Latin
Farmacéutica,
America,
y
in
voy
the
a
industry,
tener el honor de
pharmaceutical
acompañarlos
industry.
el día de
And
hoy
it's an
como
honor for me to
moderador de
join
esta
you as
sesión.
the
Gracias,
moderator for this
gracias por
session.
ser
Thank you
parte de este
for being
esfuerzo
part of this
colectivo por
collective
hacer
effort
los medicamentos
for
más seguros.
making
Este evento que
medications
reúne a
safer.
expertos
This
internacionales en
event
farmacovigilancia,
joins
representantes de la industria
international experts
farmacéutica,
in
autoridades
pharmacosurveillance
reguladoras, buscan
and
acercar el
regulatory
papel
authorities
activo de
seeking
los
to
pacientes, los
uh,
profesionales de
make a
la
better
salud,
life for
las
patients and
autoridades,
health
los
professionals,
médicos en la
authorities,
prevención, detección y
and the
notificación de
prevention,
reacciones
protection, and
adversas
notification
a
of
medicamentos.
any adverse conditions in
La mayoría
medications.
de estas sesiones van a ser conducidas en
Most of the
idioma
sessions will
español.
be
Sin
in
embargo, algunas de las
Spanish.
sesiones van a ser en
However,
idioma
some
inglés.
will be
No
conducted in
obstante, la
English.
traducción
However,
simultánea al
interpretation is
español, al
activated
inglés, al
into
portugués
Spanish,
va a
English,
estar
and
habilitado a lo
Portuguese.
largo de
It'll be
toda la
enabled
sesión.
throughout the
Si
session.
usted deseaba
If
escuchar las
you
intervenciones en
wish
idioma
to hear the
distinto al idioma que está
interventions in the
utilizando el
language
panelista,
you
pues en la parte
desire,
inferior de su
then
pantalla
on the bottom
encontrará
part of
como
the
similar a un
Zoom
globo
toolbar, you
temático.
will
Allí puede
see a
seleccionar si
globe
desea
icon
escucharlo en
and you'll
español,
be able
inglés o
to
portugués. Y
choose
para
the language of
mejorar la
preference,
calidad del
English,
audio,
Spanish, or Portuguese, and to
solamente pues
improve
debe
the quality of the
colocar
audio, all you have to
mute
do
en
is
audio
mute
volumen.
original audio and you will
¿Cuáles son
only
los
hear the
objetivos de este
interpretation.
espacio? Pues promover
So the
la
goal of
notificación de
this
reacciones adversas a
forum is to
medicamentos,
promote
fomentar la
the
colaboración, como mencionaba
notification
anteriormente,
and
y
culture of
conmemorar
security in
el 10º
medications and
aniversario del
commemorating the
MedSafe.
10th
Y la
anniversary
agenda que nos
of
convoca
the
el día de hoy
program.
ha sido
And the
pues
people joining us today
cuidadosamente
have been
diseñada para
carefully
ofrecer una visión
chosen
global práctica, en
to
este
offer
caso de la
a practical
farmacovigilancia.
mission for
Vamos a iniciar con una
pharmacovigilance.
intervención
And
por
we
parte
are
de la
going to
Industry
start
Monitoring Center
with an
sobre
intervention
reflexiones de una
uh,
década de
on the
corresponsabilidad,
reflections of one
avances y
decade
acción global por
of
la
work
seguridad de
in
los
global
medicamentos.
actions.
Posteriormente vamos a tener una
Then we
presentación
will
del
have a
Instituto de Salud
presentation
Pública de
by
Chile,
the
donde
Institute of
vamos a
Public Health in
conocer cómo
Chile,
Chile
where we're going
fortalece
to
la
understand how
participación del
Chile
paciente en
strengthens
la seguridad de los
patient participation
medicamentos.
in
Vamos a conocer las
medication
estrategias de comunicación,
security and
planes de
assurance,
reporte y gestión
strategies,
de riesgos del
reporting,
sistema chileno
risk
de
management in the Chilean
farmacovigilancia.
system in
Posteriormente
pharmacovigilance.
vamos a
And
tener un
then
panel de discusión
we are
dinámico y
going to have
multisectorial
a dynamic
con
panel
representantes de las autoridades
to
regulatorias
see
nacionales. Nos va a acompañar el magíster
the
Edgardo
or to
Domínguez
discuss with
del
the
Centro
authorities
Nacional de
and
Farmacovigilancia del
for example
Panamá,
Diana
y así Para
Dominguez and
Cuevas,
or Edgar
representante del
Dominguez, I'm
paciente
sorry, Diana
de
Gonzalez,
ética y
Bautista from
supervisión de
Pharma,
Colombia,
Para
la doctora
Cuervo, Liliana
Liliana
Vargas,
Vargas Neri, jefe del
Francisco Sierra,
Departamento de
Dr. Liliana
Farmacoepidemiología,
Vargas from
Infantil de Médico
Pharmacoimmunology,
Gómez de
and
México, y
different
Francisco
physicians from
Sierra en representación de la industria.
Mexican health system, and
Nuestros
Francisco Sierra
moderadores
also joining us
estimados
from
colegas,
Colombia.
José
So
Bautista de México
we
y
have
Diana
the
González de
colleagues
Colombia.
Diana
Esperamos que
Gonzalez
esta
from Colombia and
sesión
Jose
la
Bautista from
disfrutaran como
Mexico.
nosotros
So we hope you
disfrutamos
enjoyed this
diseñándola.
session as much
Y
as
para
we
arrancar
have
oficialmente esta
in
actividad quiero
preparing
invitar
it.
a la sala
And
a Janet
welcome
Gija,
to
directora
our
ejecutiva de FIFARMA.
executive
Janet, muchas
director
gracias por
at
acompañarnos.
FIFARMA,
Adelante, por
Janet
favor.
Muchas
Yija.
gracias, Diego, y muchas gracias
Thank you,
a todos
Diego,
los que
and
organizaron y
thanks
que hicieron
everyone who
posible
organized and made it
este
possible
encuentro
for us
del
to
día de
have
hoy.
this
Para mí
encounter
es un
today.
verdadero gusto darles la
For me,
bienvenida a
it's
este
a
webinar.
pleasure to
Como el
welcome you to this
mismo dijo,
webinar,
conmemoramos el
where, as
décimo
Diego said,
aniversario
we
del
are
enfoque
commemorating the
global
10th
de Med
anniversary of
Safety.
the
Es una
Med
iniciativa que nos
Safety Week
recuerda que
global
todos tenemos
campaign,
el
which reminds us that
poder
we
de hacer
all
que los
have the
medicamentos sean
power
más seguros,
to
de
make
la mano
medications
de
safer.
cada uno de nosotros.
Hand in
Darles y
hand,
poder
in
hacer más
everyone's
medicamentos
power, we
es una
have
responsabilidad compartida.
the
Admiro la
responsibility
perspectiva de quienes conformamos
to
el
make
ecosistema en salud,
medications
los
safer,
pacientes que
safer,
reportan y que
and in the
experimentan, los
ecosystem
profesionales
in
que
health
observan con
to
rigor,
make
las
things easier.
autoridades que regulan
So
con
the
compromiso y la
authorities, the
industria que actúa con
patients, the
transparencia
physicians,
y
the
compromiso.
professionals, everyone
Cada
acting
uno desde el rol
transparently
que
and with
tenemos
commitment.
contribuye a que la
So from our
eficiencia
role,
en
we are
nuestros tratamientos y en los
contributing
sistemas de
to the
salud se fortalezca
efficiency in our
día a día.
treatments and
En América
strengthening our
Latina, este
medications.
mensaje adquiere un valor particular. Nuestra región
In
sigue
Latin America,
avanzando
the
hacia
message
sistemas
becomes
más
stronger
resilientes, más
because we are advancing
colaborativos
towards
y
more
centrados en las
collaborative
personas, donde la
systems,
farmacovigilancia
people
no
focused,
se
where
entiende como un proceso
pharmacovigilance
técnico,
is
sino
a
como una
not just a
herramienta
technical
clave
process,
para
but it's a
garantizar la
key
seguridad del
tool to
paciente y la
guarantee
calidad de
the
la
patient's
atención. Este
safety and
webinar en el que estamos el día
the
de hoy
quality of
busca
their care.
precisamente eso,
So this webinar
reconocer
seeks
el papel
exactly that,
activo
to
de
acknowledge
cada
the
actor
active role
en la
of each
prevención,
player
detección
in the
y
prevention and
notificación
intervention
de
and and notification of adverse reactions, and promoting co-responsibility, transparency, and trust as fundamental pillars of
A través de las
safety and
experiencias que
security in
tenemos el
health.
día de hoy y las
So, learning from
reflexiones
the
que compartiremos,
experiences and the
podremos seguir
reflections
construyendo
that we will
una cultura
share,
sólida de
we are
farmacovigilancia
presenting a
en la
solid
región.
culture
Desde
in
FIFARMA,
pharmacovigilance in the region.
desde este
From
rol que
FIFARMA,
cumplimos,
this is
reafirmamos nuestro
the
compromiso de seguir
mission, and we are
trabajando de la mano con
reaffirming our commitment to
autoridades,
work hand in hand
profesionales y
with authorities,
pacientes para fortalecer
professionals,
esa
patients,
cultura,
to
impulsar el
transcend in this
intercambio de
culture
conocimiento y
and to
contribuir a que
seek
esto
the
sea un
exchange of
responsable compartido.
knowledge.
Les agradezco a todos por
So,
acompañarnos y por hacer parte de este esfuerzo
we
colectivo.
thank you all
Que esta sesión
for
sea
joining
un
us in
espacio de
this session
aprendizaje,
and for
de
this session to
diálogo, de
be of
colaboración que
dialogue,
nos acerque aún
collaboration,
más a un objetivo
and
común,
to
que
come
es tener
closer to
medicamentos
a
más
goal,
seguros
which is
y
to have
eficientes más protegidos. Muchas
safer
gracias y
medications.
muy bienvenidos a
And
todos.
thank you
Diego,
all
prosigue
very
con la
much.
agenda del día de hoy.
Muchas gracias, Janet, por
Thank
enmarcar
you,
el
Janet,
propósito de la jornada del día de hoy,
for
por
framing
ratificar nuestro
this
compromiso y, por
purpose today,
supuesto, por
to
esa
acknowledge our commitment
cálida bienvenida.
in the
Y antes de dar
warm
paso a las
welcome. And before
ponencias,
handing
queremos
over
invitarlos a un breve
to the
espacio de
presentations, we
interacción.
want to
En
invite
su
you to a
pantalla en
brief
este
space for
momento ustedes
interaction.
pueden ver
So
Menti. Al
here,
escanear ese código QR
when
que
we
aparece en su
scan
pantalla, lo
this
pueden escanear con sus celulares, van a
this QR
encontrar una
code with
serie de
your cell
preguntas
phones, you will
totalmente
be able to
anónimas,
find
solamente
some
que quiero
anonymous
conocer un
questions,
poco
and
de
we
parte
just
de ustedes.
want
Por
to
ejemplo,
understand from
si han
you
oído hablar
if you've heard
anteriormente del Med Safety
previously
Week.
of
Así
Med
que vamos a
Safety
esperar
Week.
unos segundos
So
para
we're
que
going to wait a
puedan
few
ustedes
seconds for
escanear
everyone to scan the
el
QR code
QR y pueden ir
and
allí
to then
reflejando sus
reflect
respuestas.
their answers.
Vamos a copiar también aquellos que no puedan
So we're going to
escanear
copy
el
those who
QR.
have not scanned the
En
QR
el
code,
chat de
and
este
in the
webinar van a
chat of this
encontrar
webinar,
los
you're
el
going to
enlace
find
directo al Menti. También pueden
the
ingresar a través de
link to Menti,
menti.com y
and you can
usar
go to
el código
menti.com,
6395
and
39
here we have
82
the
para
code,
reflejar su
which is
respuesta.
on
Vamos a esperar
screen
un
so you
momento
can
más que se puedan
show
unir.
your answers. 63953982 is the code.
Muy bien, le vamos a pedir a nuestros colegas que nos están apoyando con el
I'm going to
Menti
ask our
que comencemos
colleagues
a reflejar los resultados.
to display the results.
Tenemos 42 personas que están
We
en
have
este
42
momento en el
people
Menti.
who are on the Menti now.
Muy bien. Parece ser que las respuestas
So
no se están reflejando. Vamos a hacer una prueba
apparently
con
we
la
can't see the
siguiente
answers. Let's
pregunta,
test
por
with the next
favor. Nos movemos a
question.
la siguiente.
And
Vamos a ver y nos podemos devolver. Si su respuesta es sí, les invitamos por favor aquí a
the
comentarnos de
answer
qué se
is
trata, qué
yes,
opinan sobre
then
la
we will
campaña,
accept your
qué han
comments. What do you think about the
escuchado del
campaign
Menti.
and what you've heard or seen in the Menti?
Bien, los invitamos por favor a reflejar sus respuestas. Muy bien. De nuevo, el código QR. Por favor, los invitamos a
QR code is
compartir sus
on.
apreciaciones.
You can now share
Bien, tenemos 48 personas que
your
están en el
thoughts, and we have
Menti hoy en este
48
momento.
people on the Menti ready.
Ok, tenemos personas que nos
Right, so
comentan
we
que no
have
han
some
escuchado del
people who are
Menti,
saying that they
algunos
have
otros
not been
que nos
able
comentan
to
de
see the
que han
Menti.
escuchado que el Med Safety
Others
Week se
are
trata de la
saying
seguridad de
about
todos,
Med Safety
la
Week.
semana de los
It's
medicamentos
about everyone's
seguros que
safety.
organiza el
So
Sala
the
Monitoring
week of
Center,
safe
también
medications.
sobre reportes de
So
notificaciones
also on reports
adversas.
and
Alguien comenta
notifications.
por aquí que es una gran
So someone's saying that it's a
oportunidad
great
para unirnos.
opportunity
Alguna
to
persona
come
menciona no
together.
he escuchado hablar de la
Some
campaña
mention not
anteriormente,
having heard of the
lo
campaign
cual que es
before, which
precisamente el
is
objetivo de esta
precisely the
actividad, continuar
goal
promoviendo
to continue
el Med Safety
promoting
Week, este
Med
objetivo
Safety
tan
Week.
valioso que cumple.
This is such
También
a
fomentar la notificación de
valuable
efectos adversos.
mission and
Fantástico,
goal,
muchas gracias.
and
Vamos a
also on
movernos
adverse
a la
effects. So
siguiente pregunta para
let's move on to the
conocer un
next
poco
question
más
and get
de
to know a little bit
ustedes.
more about you.
Muy bien. ¿Cuánto sabes sobre los efectos
How much
secundarios
do you
no
know about the
deseados de los
secondary
medicamentos?
effects
Siendo
of these
lo
medications?
mínimo y siendo 5
One
lo
is the least,
máximo.
5 is the
Vamos a
maximum.
escuchar
So we're
sus
going to
respuestas. Muy
hear
bien,
your and
tenemos
see your
12
answers.
personas que
We have
saben
12
mucho sobre
people
los
who
efectos
know a lot
secundarios
about
de
the
los
side
medicamentos. Esto
effects
significa que tenemos
of
muchos
these
farmacovigilantes que
medications.
nos
We
acompañan
have a lot of
en
pharmacovigilance
esta jornada. Vamos a movernos a la
vigilance
siguiente pregunta
experts.
también
So
para
we're going to go
conocer
to
un
the next
poco
question
más
now.
de
So
ustedes. Y la pregunta es,
The
¿crees
question
que sabes lo
is, do you
suficiente
think you
sobre
know
este tema?
enough about
Vamos a esperar también para
this
escucharles un
topic?
poco.
So
Muy bien. Parece ser que el no va ganando. Muy bien.
apparently the no is winning so
A
far.
todas las personas que están conectadas en el Menti, recuerden que pueden usar el código
So
639539
remember code
82.
63953982.
Algunas personas nos comentan que sí
Some
saben
people
bastante sobre
say
este
that
tema. Muy bien, fantástico, fantástico.
here is
Vamos a pasar a la
fantastic.
siguiente pregunta.
So let's go to the next question.
Y la siguiente pregunta es, ¿qué te
And the
gustaría
question
saber?
is,
¿Qué te
what
gustaría
would you
saber un
like to
poco
know?
más sobre la
If
seguridad
the
de los
answer is no, what
medicamentos, sobre
would
la
you like to
seguridad de los
know
pacientes,
about
sobre la seguridad de las
patient
personas,
security,
sobre el Med
product
Safety Week
assurance,
también?
med safety week,
¿Dónde
etc.?
debemos reportar?
So
Creo que
where
ese es
should
un
we
punto
report
importante y es una
this?
media
This is a very
en
important
muchos
point,
de los
and
países
it's
de América Latina.
mean
¿Cómo
in
podemos
many
ser
of the
más
countries in Latin
activos?
America. How can be an
Totalmente de
active
acuerdo.
part
¿Cómo
of
podemos los
this?
pacientes, los
How
profesionales de la
can the
salud, las
patients,
autoridades
health
reguladoras
professionals, and
ser
regulatory
más
entities
activos?
be
Nuevas
more active?
investigaciones. El
New
papel de los pacientes.
research,
¿Cuál es el
the
papel de los
role of the
pacientes en la
patients. What is the role
seguridad
of the
de los
patients?
medicamentos?
Medications, etc.
Armonización en América Latina.
Harmonization
¿Cómo
in Latin
comunicar
America,
mejor?
how to communicate better,
Eficiencia e impacto.
efficiency,
Muy bien. ¿Qué
impact,
áreas de mejora y de
what areas
oportunidad
of
existen?
improvement do we
Muy
have?
bien. Fantástico. Absolutamente fantástico.
So
Muy bien. Y
fantastic.
vamos a pasar a la
And
última pregunta que tenemos para
last
ustedes hoy.
question that we have for you today.
¿Has experimentado
Have you
alguna vez
ever
un efecto
experienced
secundario de
a
un
side effect
medicamento?
from a medication?
Wow. Wow. Muy bien. Muy bien.
So, very good.
Muy bien. Creo que tenemos una pregunta más para
I think
ustedes también
we
antes
have a
de dar
question for you
inicio.
as well before we get started.
Muchas personas, casi todos
Many
los que se
people,
unieron al
almost
Menti, nos
everyone who
comentaron que
joined the Mentee
efectivamente
said,
sí
indeed,
ha enfrentado un
they
efecto secundario
have
alguna vez en su
faced
vida y
side
queremos comentarles que
effects
saben que se
at least
pueden
once in their
notificar los
life,
efectos secundarios.
and
Muy bien,
we
tenemos
can
algunas
ask them if you
personas que nos
can
comentan que no.
notify them.
Muy
Some say
bien,
no.
muy
Okay,
bien, perfecto.
perfect.
Muy bien,
So
podemos movernos al siguiente. Muchas
we
gracias a
can
todos
move
por
to the next
participar.
one.
Perfecto, perfecto. Muchas gracias por ser parte de
Thank
esta
you very much for
dinámica
being part
y
of this
por
dynamic
acompañarnos.
and
Al final de esta sesión
for
vamos a
joining
tener
us. At the
una
end of the session,
dinámica
we're
muy
going to
similar
have
con ustedes
a very
y el
similar
objetivo es poder
activity,
arrancar esta sesión con eso es un poco para
and
conocerlos, para
the
conocer nuestra
goal
audiencia,
is to get to know our
conocer hacia dónde
audience
debemos
and
enfocar
to know
las
where to
discusiones.
focus
Pero sin más
this
preámbulo,
discussion.
quiero
However, without
extender
further
una
ado, I want to
cordial
extend
bienvenida a
a
Frederick,
very warm welcome to
Communications
Frederick,
Officers del
Communications
USALA
Officer
Monitoring Center.
at
Frederick
the
cuenta con más de 25 años de
Monitoring
experiencia en
Center, with over
comunicación,
35 years
participación
experience in
pública e
communication, public
investigación en
participation,
países
in
como
research,
Suecia
in
y Nueva
countries like
Zelanda.
Sweden, New
Frederick es
Zealand.
farmacéutico de
Frederick
profesión y
is
también
a
cuenta con un
professional
máster en
pharmaceutical
periodismo
uh,
por la Universidad de
and
USALA.
also has a
Frederick nos
master's
va a
degree in
compartir
journalism from
algunas
Uppsala
reflexiones
University, and he's
sobre
going to
esta
share
década
some ideas
celebrando el Med Safety Week.
on this
Frederick,
decade of
thank you
Med
so
Safety
much for
Weeks. Thank
accepting
you so much,
our
Freddie.
invitation. It means an honor to have you with us on this special day as we commemorate the 10th anniversary of the Med Safety Week. We now invite you to share the screen and take the floor.
Thank you very much, Diego. And this was a very nice start to see the survey that you held here. I hope you can see my screen now.
Yes, we can.
Excellent. So thank you for having me here today. Diego, Janet, and hello everyone. Buenos dias. My name is Fredrik Bronius, and I'm a communications officer at Uppsala Monitoring Center, where I am part of the team that coordinates the Med Safety Week campaign every year. So as Diego said, my own background, I'm a pharmacist, but I've worked mostly with medical communication and public engagement in science over these past 25 years. And I'm very grateful to FIPHARMA for arranging this webinar and for giving me this opportunity to talk a little bit about Med Safety Week with you all. For those of you that may not be familiar with the Uppsala Monitoring Center, or UMC, we were established in 1978 as an independent, self-funded, non-profit foundation dedicated to safer use of medicines and vaccines. We operate the WHO program for international drug monitoring through an agreement between the government of Sweden and the World Health Organization. In this program, we support over 180 member countries and regions in strengthening safety surveillance of medicines, and we maintain Vigibase, the WHO global database of adverse events reports for medicines and vaccines. And we provide international standards and digital solutions so that pharmacovigilance data can be exchanged in secure ways, including a global medicine terminology for identification of medicinal products. And we advance the science of pharmacovigilance and transform its practice via technological innovation. And this is our vision, safer use of medicines and vaccines for everyone, everywhere. And we think that initiatives such as Med Safety Week are an important piece of the machinery, so to say, when working towards that vision. Now, let's take it from the beginning. Why this focus on the safety of medicines? Well, as you know, it's simply because medicines, as useful as they are in alleviating illness and suffering, they are also a significant cause of illness and suffering, both on the individual and on the societal level. And as many of you also know, it's hard to pinpoint exact figures here, but if we look at Europe as an example, recent studies suggest that harm from medicines accounts for 1 in 20 of hospital admissions and is the 5th leading cause of hospital deaths. And this patient suffering is also a significant burden on the healthcare system, with an annual price tag of approximately 79 billion euro. So anything that we can do to improve the safety of medicines will have a positive impact on our health and society as a whole. As the regulatory process works, when new medicines are approved for marketing, they have been tested on a limited number of patients during clinical trials. And this means that we have a limited knowledge about how safe the medicines are for the wider population, and that we need to monitor the medicines as they are used in society to build that knowledge. And a cornerstone here in that monitoring is that patients and healthcare professionals report any suspected adverse drug reaction to the national responsible authority so that the authority can follow and investigate any signs of safety problems and take regulatory action if need be, such as amending the safety information for the medicine and communicating this to all stakeholders so that the medicine can be used in a safer way. And this is a good system in principle and also in practice, but the problem is that just a fraction of adverse events are ever reported. And again, it's hard to determine the precise magnitude of the problem, but global data suggests that less than 1 in 10 of serious adverse events are reported, less than 1 in 10. And between 1 to 3 out of 50 non-serious adverse events are ever reported. So in other words, what is being reported is just the tip of the iceberg. And the question is, why is this? So in 2 recent review studies, researchers found that the most common reasons for not reporting suspected side effects for healthcare professionals, they are a lack of knowledge, for instance, believing that only serious adverse events need to be reported, a lack of motivation, this can be procrastination, a lack of interest, and a lack of vigilance, believing that only well-tolerated medicines would be allowed on the market. So in the review papers, the factors are called ignorance, lethargy, and complacency. But here I have taken the liberty to rephrase them to a slightly milder terminology. And the top three is the same for patients, although in a slightly different order, as you can see. So we can say that underreporting is a complex challenge that largely depends on the effects of human behavior. And like other complex problems, it requires complex solutions or multifaceted solutions. So policy changes and technical innovations can help change behaviors, and that's great. And naturally, we also need to make sure that the reporting process, the way that the reporting works, is both accessible and user-friendly and adapted to the needs of the different stakeholders, if they are patient or if they are healthcare professionals or other societal stakeholders. But raising people's awareness of why and how they should report adverse events is the necessary first step. And this is where the Med Safety Week story begins. So in 2016, the Medicines and Healthcare Products Regulatory Agency in the UK, the MHRA, they were leading work on tackling underreporting as part of a large EU project called SCOPE, which stands for Strengthening Collaboration for Operating Pharmacovigilance in Europe. And in this project, they had conducted a survey to understand how 24 regulators in the EU communicated to the public about adverse drug reactions. And the survey showed that only 14 of the 24 regulators had run, 14 of the 24 regulators had not run a public campaign in over a decade. And only 5 had used social media to promote the reporting of suspected adverse drug reactions. And we should say at this point in time, as much as half of the European population were active on social media. So this was a resource or a channel that was largely untapped when it came to patient communication. So all these things considered, the MHRA decided it was time to try something new. And the first Adverse Drug Reaction or ADR Awareness Week, because it wasn't called Med Safety Week back then, it was run in November 2016. And the MHRA produced animations and infographics like the one that you can see on this screen that other regulators could use on social media to encourage patients and healthcare professionals to report suspected adverse drug reactions. And this is what participation looked like if you take a look at this map, that first year of the campaign. And as you can see, it was a regional initiative, but as such, still pretty ambitious, with 23 organizations in 22 countries and campaign materials being distributed in 20 languages. After this first successful campaign, Uppsala Monitoring Center was brought on board together with the MHRA to bring more regulators and other stakeholders on board on a global scale to establish an annual International Pharmacovigilance Awareness Week. And that's how Med Safety Week was born. Today, 10 years later, the campaign has grown into a worldwide movement. Since 2019, any member country in the WHO Program for International Drug Monitoring can participate. And the 2025 anniversary edition, with 132 organizations, which include regulators, pharmacovigilance centers, national and international organizations such as FIPharma, with a strong focus on medicine safety in 118 countries, and campaign materials in more than 60 languages. This is the largest campaign we've had to date. And also, as you can see on the map, the campaign is strongly represented in Latin America and the Caribbean, where we are fortunate to have many engaged and creative partners also in our planning team. And we are very grateful for this. And this is a quick view of how the campaign has grown over time. And we were joined already in 2018 by our first partners from Latin America. And as you can see, this list has grown quite a lot since then. One of the big challenges in developing an international campaign like this is ensuring that the messages and the graphic materials that we produce are going to work across borders and cultures. And this is one reason why Med Safety Week messages, if you have seen them, you may have noticed that they are always kept brief and simple. And this is so that they can be easily understood, translated, and also adapted to local audiences. And in line with this universal communication strategy, the protagonists, the main characters in the materials, as you will also know, they are not humans, but they are colorful. We call them blobs, for lack of a better word, but cartoon characters that can cross that cultural differences and also allow for spectacular side effects to argue the point and to catch the viewer's attention. So over the years, for those who have followed the campaign, you may have seen the blobs inflate, explode, shift color, or even catch fire, as last year, as a consequence of taking medicines. And every year, the campaign has a certain theme related to medicine safety, such as pregnancy, polypharmacy, which means taking many medicines at the same time, vaccines, and also the role of healthcare professionals and patients in the pharmacovigilance system. But the key message of the campaign, to report suspected side effects, that is always at the center of the campaign. So then our partners in different countries all over the world, in their online campaigns, they use and adapt the materials that we supply to suit their target audiences in their specific cultural context. And I'm just going to show a few examples from last year's campaign, where we have first a webinar in Cabo Verde. We have a quiz in New Zealand. And this was quite innovative. It was a competition for pharmacists in Namibia entitled Battle of the Pharmacy. It was immensely popular, we were told. We had social media pledge cards. We had video tutorials on how to report side effects. We also have personal videos from community pharmacists, and this one is from the UK. And we also had, we even had a blooper reel from Namibia. And although Med Safety Week started out as a social media campaign only, it has over the years expanded into including more and more real life events as well. And this is, of course, thanks to our creative and dedicated national partners and their collaboration with local stakeholders, such as pharmacies, hospitals, schools, universities, to spread the campaign message in the communities. And I must say, this is one of the absolute favorite parts for me personally of the campaign, to see what our partners have been up to all around the world. And we're going to have a quick look at a few examples now. The first one is from a puppet theater in Mexico, and I'm sad to say that we only have a still image of this. I would have loved to see the puppet theater in action to see what the story was about. We have medicine safety talks in Venezuela to the left, street banners in Yemen to the right here. Photo frames are often a popular thing that our partners produce, and these ones are from Egypt to the left and Cabo Verde to the right. We have pharmacovigilance events in Peru, reaching out to, I think it's healthcare professionals in this screen. We have outreach activities in Iraq, and to the right, you see a Zanzibar school visit. Even during the pandemic, the campaign went on. It was a special challenge, of course, during that time. But this is a healthcare facility that took part in the campaign in India in 2020. We have had pharmacist ambassadors in Luxembourg and radio appearances in Namibia, press conferences in Montenegro, and this giant jumbotron in downtown Manila, where the Philippines Drug Regulatory Agency every year collaborate with a national pharmacy chain to have the Med Safety Week animations shown on their screens across the city. Now I thought we would take a quick look at the 2025 campaign, which, as you know, will start on Monday next week. And this is what we're looking at this year. We can all help make medicine safer. That is the theme. And the audience we are looking to reach, it's patients, carers, and healthcare professionals, and as usual, and we want them to report side effects, but also we want to increase their awareness of national reporting systems. So who do I report to? How do I do it? And the key messages are that medicine safety starts with you and me. We all have a place in the pharmacovigilance system. And that reporting side effects helps make medicine safer for everyone. And the tagline, we all have the power to make medicine safer. And since reporting side effects is something that helps to make medicine safer for everyone, we decided to go with a superhero theme for the animations this year, because when you think about it, it is a bit like a superpower, actually, that we all have the power to make medicines or the use of medicines safer for everyone. And these are some of the campaign assets that we have produced and distributed to our partners. So we have the animations, we have a campaign guide that walks you through the campaign from A to Z, what to do and when to do it. We have a template press release that you can use to raise media attention in your country. We have a social media plan that goes through the ins and outs of when to post what and how to do it. A graphic guide and lots of different graphics, both for print use, such as for t-shirts or stickers or posters, but also lots of things to use online. For instance, social media banners, Teams backgrounds, and more. And these campaign assets, our partners then decide for themselves which assets that they want to use and how they want to use them. And the purpose with this campaign package is that we want everyone to be able to run a Med Safety Week campaign on a very, very limited budget and with limited resources, so that all countries can take part in the initiative if they want to. Now, as we have talked about now, over this decade of Med Safety Week campaigns, we have produced lots of materials and our partners have carried out lots of activities around the world. But to what extent has this made a difference? As with many communications projects, it's difficult to determine how big the actual impact has been. And during the first years, we collected statistics on ADR reporting figures before and after the campaigns to see if we could discern any patterns. But unfortunately, or maybe as expected, the results were inconclusive. Because although reporting figures may seem like the obvious outcome to measure for a campaign like this, those numbers are always affected by a multitude of factors besides Med Safety Week, of course. So the larger impact that we are aiming for in the campaign is the safer use of medicines and vaccines. And this occurs in society. And as I mentioned, it is very difficult to measure to which extent our campaign is contributing to this. But this doesn't mean that we shouldn't try to do it, because it is important to see what are we doing that works and what are we doing that perhaps is not working as well. And some things may work in different countries and not in others. So this year, we are running a pilot evaluation project with a handful of experienced campaign partners to test methods and metrics that we can use to measure other outcomes. And the survey or the Menti exercise that you had just now was is part of that with our Colombian partners and Francisco Sierra, who is part of this pilot. And I was very happy to see that activity in action. So what we want to do is that we want to test other methods and metrics that we can use to measure the outcomes that occur in our audience and that we can assume will contribute to the impact that we ultimately want to achieve on a societal level. And this includes, for instance, awareness of where and how to report side effects and also the motivation to do so. And the pilot will include a mix of quantitative and qualitative approaches to measure campaign outcomes, from social media analytics and surveys to stakeholder interviews and focus groups. And we are hoping that the experiences that we gather in this pilot can help us build an evaluation toolbox which all MedSafety Week participants can use to evaluate future campaigns. And we're aiming to launch the first iteration of the toolbox already next year. One thing that we actually can say already now is that both we at UMC and our partners in the pilot group have found it very useful to have this group setting for a deeper level of knowledge sharing between partners from different countries. And I think this is something that we definitely want to explore and encourage more in the future, sharing the collective experiences and wisdom that we have in the MedSafety Week community. And that was all from me. And I would like to say on behalf of the campaign production team at UMC, we want to say a warm thank you to everyone who has contributed to the MedSafety Week campaign over the years, especially our planning team members, partner organizations, and local stakeholders around the world. So thank you very much for your attention. Muchas gracias, and welcome to join the campaign. Thank you.
Thank you very much. We would like to express our thanks to Uppsala Monitoring Center for this great initiative and for sharing the story of MedSafety Week. We invite to all our colleagues to join the MedSafety Week, which officially begins next Monday, November 4th, and we truly appreciate your support and collaboration in organizing this event. We also invite our attendees to share their questions in the Q&A chat, which can be found at the bottom of your screen. Thank you again, Fredrik.
Thank you, Diego.
A continuación, tengo el honor de presentar y de invitar ahora a la
Now I have the honor to introduce Dr. Veronica Vergara, who is sharing a presentation called From Reporting to Action, How Chile Strengthens Participation of the Patient in Drug Safety, Reporting Channels, Communication Strategies, and Risk Management in the Chilean Pharmacovigilance System. She is a pharmaceutical chemist with a master's degree in technical epidemiology and a certificate degree in public management, specializing in technical pharmacovigilance. Over 15 years experience. She's occupied key positions in VIMA in Colombia and the Chilean ISP Health Institute, and she is the head for pharmaco and cosmetovigilance. So here we have the committees, and here we have SARS-CoV-2 experience as well. She's an expert in pharmacovigilance recognized by WHO, and she's been coordinator of focal points in pharmacovigilance from the Americas, and she is a member of the Pan American Safe Vaccination Committee. She's a whole institution for Latin American pharmacovigilance. Dr. Vergara, thank you for being here and being part of this activity, and the floor is yours.
Muchas gracias, Diego.
Thank you, Diego, and very, very happy to share this forum with everyone. Thank you, Free Pharma, for the presentation, the words of Janet, and the introduction of Fredrik. The presentation by Fredrik is a very good introduction to what I want to share with you. I'm going to share my screen with you, and here we have This
Ya, como bien
okay, now we can see the
mencionaba,
screen.
Diego, la
So
idea
as you
de
can
estos
see,
minutos de
the
presentación
idea
es
with these
poder
minutes in presentation is
llevar un
to
poco a la práctica, ¿cierto? Desde una
lead
autoridad
the
reguladora,
practice
desde
with a regulatory
de un Centro
identity
Nacional de Farmacovigilancia,
for
estas acciones
pharmacovigilance,
y estas
and
actividades que
this
llevamos a cabo en
action and these
torno de
activities
la seguridad de los medicamentos.
and with the
Tenemos
medications and
claro
safety,
que los medicamentos no son
we are
100%
clear that
seguros,
medications are
¿cierto?
not
Que
100%
pueden
safe,
presentarse
and
ciertas reacciones
they could
adversas
show
con el
certain
uso
adverse
tanto de
reactions with the
medicamentos como
use
vacunas,
of
pero que tenemos un rol fundamental
we play a fundamental role
todos, diversos actores,
with diverse
incluyendo las
players,
acciones que
including
llevan a cabo las
the
autoridades reguladoras
actions
para poder
with the
identificar
regulatory
estos
uh,
riesgos y,
groups to identify
por
these
tanto,
risks
poder proponer
and
medidas en torno a
to suggest
mitigar
measures in
estos
regard to
riesgos o
mitigating these
prevenirlos cuando
risks
sea necesario. Entonces, para dar un poco de
when necessary.
contexto, en Chile, la Autoridad
In
Reguladora de
context, in
Medicamentos y
Chile, the
Productos de
regulatory
Salud Pública, ¿cierto?
institutions
Que es
in
el
public
órgano
health,
referente del
this is
Estado,
the
que se encarga
entity that
de
regulates the
diversas
state,
cosas,
is in
encarga
charge
de
of several
proteger la
things
salud de la
in
población,
protecting the health of the
estableciendo y llevando a
population,
cabo diferentes acciones,
strengthening
tanto de
and
vigilancia,
taking key actions
supervisión,
in vigilance and
fiscalización, entre
updating,
otras.
among others.
Para contextualizar aún
And to
más,
bring context,
este es el
this
mapa de
is
Chile,
the
como pueden
map
ver,
of
es un
Chile. As you can
país
see, it is a
largo y
country
angosto,
that is
por lo
very
tanto hay
long and
ciertas
narrow. Therefore,
dificultades
there are
en
certain
torno a la comunicación y a
difficulties
la
regarding
coordinación
communications and
algunas veces.
coordination sometimes.
Chile cuenta con
And
16 regiones de norte a sur,
here
según el último censo
we have
realizado entre
the
el año
census that
pasado
was
y los
done.
resultados entregados por
And
este año con las proyecciones, tiene un poco más de 20 millones de
here we
habitantes.
have over 20 million
Y
inhabitants.
tener en cuenta
And
que nuestro sistema de farmacovigilancia es centralizado,
here,
¿cierto?
this
Hay
is
una
centralized. We have
coordinación, ¿cierto? Hay
some
una coordinación y unos
coordination,
servicios de salud existentes en cada una de estas
and these exist in many
zonas
of
y
these
regiones, y
zones.
todas las actividades en torno a la notificación, a la
All the
gestión, a la
activities in
evaluación y la
regard
toma de
to
decisiones
management,
se
decision
realizan
making,
a
risk
nivel
management
nacional.
are
Tenemos
done
un
at
promedio de
national level. We
notificación
have an average of
de unos
identification
23.000
between
a 24.000
23 to
notificaciones por año.
24,000 notifications per year.
Se ha mencionado
And we have
en este
mentioned
rato de que la
during
farmacovigilancia es
this
una
time that
tarea de todos, de que
pharmacovigilance
todos
is
tenemos,
everyone's
¿cierto?,
job. We
el
have
deber de hacer los
the
medicamentos más
duty
seguros, y
to
podemos decir que este
make
es el
medications
pilar de la
safer, and we can say that this is the
farmacovigilancia.
pillar
Por lo
of
tanto,
pharmacovigilance.
nosotros en el
Therefore,
ISP tenemos
we
como
have
propósito dentro del
the
Programa Nacional de
purpose in
Farmacovigilancia
the program
poder identificar y
to
analizar esos eventos
identify and
adversos que
analyze
ocurren
these
con el uso
adverse
de los
events that occur
medicamentos
with the
para poder
medications, to be
evaluar si es
able to
necesario tomar
assess
ciertas
if it's
medidas,
necessary to
¿cierto?
take
Que
certain
pueden ser
measures
medidas
that may be
normativas, medidas regulatorias,
informative
pero que
measures,
sean más
regulatory measures,
tendientes a
but they are
prevenir, a
tending to
mitigar o a
preventing,
reducir
mitigating,
los riesgos
and
asociados al uso de los medicamentos.
risks
Y
associated to this.
justamente como se ha hablado,
So
nuestro Programa Nacional de Farmacovigilancia hacen parte de
in
todos estos actores que
pharmacovigilance,
ustedes
you
ven
could these are part of all the
la
players you can see
pantalla, el programa
in on
coordinado por el
screen.
Instituto de Salud Pública, pero hacen
And
parte tanto titulares de registro
this is part
sanitario como centros
of the
asistenciales, farmacias comunitarias, prestadores
stakeholders
de la salud,
like
los programas
pharmaceutical
ministeriales
entities,
y todas las
assistance
acciones que
centers,
realizamos el
and
centro y el
ministerial
foco es
programs,
la
health
población,
professionals,
¿cierto?
and
El
it's the
garantizar el
population basically.
acceso a
So to
medicamentos
guarantee
de
access
seguridad,
to
calidad y
medications that
eficacia.
are safe, that are
Y no
quality,
voy a
and
detener mucho acá,
efficient.
simplemente para mencionar que dentro
So
del
I'm going
proceso
to show you the process
de
very
gestión de la
briefly here.
información de seguridad
In
recibimos las
security information
notificaciones por
management,
parte de
we
la
give
ciudadanía,
notifications
¿cierto?
by
O
the
de los
citizens,
pacientes,
or the
profesionales de la
patients, in other
salud,
words, health
titulares de
professionals,
registro sanitario, centros
and
asistenciales,
sanitary
y a través de un
registration,
sistema de
assistance
gestión
centers, and we have
propia, que es el
a
sistema de
system for
vigilancia
creation, which is the
integrada, por donde recibimos
integrated
toda esta
vigilance
información
system where we receive
y
the
de
information,
forma posterior
and
con los
then
procesos de
with
evaluación de esta
the
información que
assessment
recibimos y los grupos de
processes of the
información y con
information we
el
receive
apoyo de
plus
un
other
comité
informations
experto,
with the experts
surgen
committee,
ciertos
then we have
productos que
certain
pueden ser
products that come up
el
that may
feedback que se
be
da a los
the
profesionales de la
feedback that is
comunidad,
given
las medidas
with the
regulatorias, los
community,
diferentes
regulatory measures,
señales y el envío
and
obviamente a
of course,
el UPSALA Monitoring Center de estas notificaciones que
the
recibimos.
Uppsala
Esto
Monitoring
es para
Center
visualizar un
with the
poco
reference you already
cómo ha
have.
ido
So this is to
evolucionando el
envision
nivel de
how
notificaciones en Chile.
these
Si
notifications
bien el
have been
programa
happening
de
in Chile.
farmacovigilancia
And so
parte
while we
en
have
el
pharmacovigilance,
1995 como una actividad
and this is a voluntary activity, but only until 2010 is there a norm that regulates and establishes responsibilities for each of the players. And I particularly share the idea that the pandemic set before and then after, before in the pharmacovigilance. So I'd never heard before about pharmacovigilance from the community, and with the framework that we have in the pandemic, and with this whole population and age groups where there is a concern that we know the process in manufacturing of the vaccines, etc. And we have envisioned this along the blue line and how this increases the notifications between 2021 2022 when the mass vaccinations occurred with COVID-19. We moved from receiving 1,200 notifications from Savi on average before the pandemic to, in 1 year, over 16,000 notifications associated to that. So we see how in the population there were adverse effects, and these were being used to treat and prevent COVID. So the decisions made, we have here we have literature, information that is sent by others is evaluated and to see if the measures can be taken. This could be regulatory in the modification of the information of health registry, could include new adverse reactions, communications, etc., and informative notes or releases on the risk and how this is addressed to identify or to treat these adverse reactions and other measures such as the medication bulletins. So this is the context to come into the topic of communications, and particularly focusing on these communications that are directed towards the citizens and the patients that we know are the main reason we have to assess the risks of these medications and how to involve them in a better way in these processes, in these programs. As I mentioned before, in the Public Health Institute, we have a notification system, the SVI, System of Integrated Pharmacovigilance Information. So we have health professionals on the one hand and health registry, assistance centers, and this group or this universe of actors is speaking of adverse reactions or suspicions of such, and medical control and medical devices. So until 2022, the notification of patients was done through a health professional. So if a patient or a citizen would have an adverse effect from medications or vaccines, they would have to communicate with a health professional, the treating physician, or a pharmacist. And so from 2022, this system opens up. And from this date on, we have a notification directly from the citizens to the Public Health Institute. And from this focus, mainly, we have the notifications of adverse events of the vaccines and others associated to medications. So within this notification system, mentioning some of the benefits or some of the qualities, we see that currently you can only notify adverse reactions in Savvy once the citizen has notified.
Hoy día no lo llamamos sistema de
And
notificación a pacientes, hoy día lo llamamos sistema de notificación del
here
público general.
we
Porque
have
recordemos
the
que cuando
notifications
utilizamos
for
las
the public
vacunas
at
no las
large.
utilizamos
When
sobre
we
una
use these
persona
vaccines, we don't use them on a
enferma, lo
person.
utilizamos generalmente sobre
We
personas
use them
sanas.
on
Entonces,
healthy people,
quisimos
so
englobarlo mucho mejor con un
not
nombre
ill
más,
people, of
más
course.
general,
So we
sistema de
decided
público
to
general, y
have
no tanto de
more of this
pacientes.
name of public at
El
large and
sistema
not
puede
patient.
notificar
And
la
this system
persona
was notified.
notificada por el
You
evento
notify the
adverso o
person
un
that
tercero. Cuando nos
has this
referimos a
adverse
un
event or a third
tercero,
party.
es
And
la
by third
mamá, el
party,
papá
we
o
mean
el
the
cuidador,
parent,
¿cierto?,
mother,
de
father,
un menor
or the
de edad,
caregiver
de
of
un
a minor,
adulto mayor, que
or of a
notifica
senior
el nombre
adult,
de esta
and that
persona
notifies
que
the name of the person
presenta esta posible
who
reacción adversa.
shows this
Luego que se
adverse
hace esta
reaction.
notificación en el
And after
sistema,
that
la
notification in
persona
the
que
system,
notifica
then the
tiene
person
que
who notifies has
solicitar
to
un correo electrónico, porque este
see
correo
that an
electrónico se
email is
envía la
requested,
información, digamos, la
sending the
constatación que el
information
Instituto de Salud Pública
that the
recibió
Public Health
su
Institute
notificación.
received the
Obviamente,
information,
se
and of
agradece, se entrega
course,
información
uh,
general, se entrega un número de caso
here
y de
there
forma
is a
posterior,
case number,
si
and
hay
then
información
if
adicional
there's any
que la
information,
persona quiera
additional information that the person
subir como
wants
un
to
seguimiento al
upload as
caso
a follow-up
inicialmente
to their
notificado,
initial case,
puede a través de este
then
mismo
they
sistema
can,
llamar
through this
ese caso
system,
inicialmente
call
notificado y
and notify
agregar
and
información
add
adicional.
any
Y ya
additional
una vez
information. And
recibido,
then after that is
obviamente pasa por
received,
todos los
then they
procesos
will
que
go
tenemos
through all of the
implementado de
processes that
revisión,
we've
validación y
implemented in
evaluación
review,
y toma
validation,
de decisión.
assessment, and decision making.
Dentro del fortalecimiento, ¿cierto?, de lo que ha sido
And
el sistema de farmacovigilancia y en
here with the
particular la
pharmacovigilance
notificación,
system, the
mencionar que
notifications,
tenemos
we
una
mentioned
gran
that
capacitación
here we have
continua que
a
se realiza
continuous training
anualmente,
plan,
incluyendo en época de pandemia. Ahí ya migramos de hacer las
and
actividades de forma presencial a
here we
utilizar más
have
este tipo de herramientas online como las que nos están
these tools to
permitiendo
use
hoy
online, like the
estar
ones that
acá en
allow
esta
us
actividad,
today to be
¿cierto?
together.
Hay
And
capacitaciones que se siguen realizando de forma presencial en
there's
conjunto
training
con
that's
los
done
servicios
together
de salud
with
de las
the
distintas regiones, pero sobre
services,
todo estamos
and
sacándole provecho a las herramientas
we
online,
are
en
making
particular
use
la
of online
plataforma
tools,
Moodle,
especially
¿cierto?, para
the
realizar cursos
Moodle tool, to
autogestionados,
take on
dirigidos
self-managed
principalmente a
courses,
los profesionales de la
and
salud, pero
especially
de
directed
forma
to health
paralela, a
professionals.
través de nuestra área de participación ciudadana,
So here we
se
have
generan
citizen participation,
notificaciones anuales de
generating
diálogos
annual
participativos y jornadas
dialogue
de
participation
participación
sessions,
ciudadana
and
que van dirigidas puntualmente a
they
los
are directed
usuarios, a la
to the
comunidad en
users.
general.
And
La imagen que va aquí al final, a la izquierda,
here
es de la última jornada informativa que
we
se realizó
have
de
the
un
last session that took
responsable de
place in
medicamentos
responsible
enfocado
use of
principalmente al tema de errores de medicación, que se hizo
medication
hace un par de
errors
semanas, donde tuvimos
and
una
prescription
amplia
errors. And
convocatoria de más de o de casi
here
300
we have over
personas, ¿cierto?, sumadas a
300
esta
people
actividad. Y el
in
otro
this
enfoque que
activity,
hoy día
and
tenemos es el de
here we have
poder involucrar en estas
the
actividades de
power
capacitación
to involve
a estudiantes
students in these training
de
sessions.
carreras afines,
And
¿ciertos?, al área de la salud,
here these
sabiendo que
are
son
in
o
the
van a ser,
health
cuando sean
field,
profesionales,
and
¿cierto?, un
to
pilar
know
fundamental dentro
that
de la
this is a fundamental
identificación
pillar
de estos
of the
efectos adversos.
identification of these adverse effects is a very important
Esto
part.
es un ejemplo
So
de las
here we have
medidas regulatorias que se toman con la información que recibimos, ¿cierto?,
the
desde
information
la
that we've
notificación
received.
individual más la evaluación de información que existe a nivel internacional.
Here
Este es un
we have this
ejemplo de
at the
modificación
national
de
level,
folletos de información al
and
profesional. Y
this is the
aparte, pues
information that we
recordarles
have
que la primera
for the
medida
patient and the health
de
professional,
mitigación de
remembering that the
riesgos,
first
el
mitigation measure
folleto, el
is
prospecto,
the
¿cierto?,
prospectus or
o
the
el nombre que le vas
brochure,
a tener en cada
and
uno
whatever
de los
name you
distintos
may
países
use
donde
in your
está la
different countries,
información de
where the information is
indicación de
included for the
utilizar
location
el
and how to
medicamento
use
en buenas
the medication in question.
No me voy a detener acá, quiero enfocarme más en la comunicación que
Here,
realizamos. Una de las
these are
medidas,
the
como veíamos, es
communications, and
emitir
one
notas
of the measures
informativas
is
enfocadas
to
a la comunidad y a
send
los
these
pacientes
notes
para
to the community and the
informar, o a
patients.
los
And
profesionales de
so
la salud, perdón, para informar nuevos riesgos, entregar
here we
recomendaciones
are
en torno
forming new
al uso de un
recommendations,
medicamento en
and
particular. La imagen que ven en sus pantallas son ejemplos de algunas de
here
estas
we
notas
have
informativas que se
these
publican en la
informative
página
notes
web del
posted
Instituto de
on the
Salud Pública,
website of the
pero
Public Health
además por
Institute.
nuestra área de
And
comunicaciones hay una estrategia de
here we have
difusión
a
de la
strategy
información
as a function
en donde
of the
una vez que se
information, where
publica una
every
nota
time you
informativa de
publish an
seguridad en
informative note,
medicamentos,
then
el área de comunicaciones
the
envía esta
communications
información a distintos
department
socios
sends to different
que
partners
son los medios de comunicación,
the
¿cierto? Con
which
los
are the
medios de
media,
comunicación
the
incluso
information,
hemos
printed
realizado
information,
actividades
and we've done activities together
de capacitación
in
cuando
training
se autorizaron
or
las vacunas incluso
when the
con
vaccines were
reuniones de nuevo
authorized, even
para poder
in
explicar
meetings
por
to
qué
be able
hacer
to
la autorización
explain
de estas
the
vacunas. Y
context.
esto ha sido una
And
buena estrategia porque ha
this has been a
permitido
great
que
strategy
cada vez que
because
se publica
every time
información de seguridad
you
es
post
replicada en los
uh,
principales medios de comunicación del
security
país, ya
information, it
sea
is replicated
prensa hoy día
in the main
digital,
media in the
los
country,
pocos que quedan de
digital
la
press,
prensa
or whatever is
física,
left
y
of
también
physical
en
press.
medios
And
especializados. Acá tenemos ejemplos de este año de
here
las
we
últimas notas
have
que se publicaron
the
en la
latest
Sociedad
notes
del
that were
Medicamento
posted.
ibuprofeno
And
ante las reacciones adversas
here we have the adverse
dermatológicas
reactions,
severas que se
severe
detectaron hace poco con el uso de este producto. Entonces vemos
dermatological
cómo se va
conditions
replicando en los
with
medios
the
de
product. So we see how to
comunicación y
replicate that in the
algunas
media,
entrevistas
and
que se
then
dieron
some
para
interviews
la
that took
televisión
place
como tal,
for
comunicando en
television,
presencia de
communicating
riesgo.
the
Dentro de esa
operation
misma
in this
estrategia que
sense.
tiene el área
So
de
in that same
comunicaciones,
strategy that we
no
have,
solamente se informa a los medios de
here we
comunicación,
have
sino
informed
también
not
se
just
hace y se
the
realiza una
communications media,
bajada
but
de esa
there
información
is
a
a
través de
download
las
of that information.
redes
And
sociales, ¿cierto? Entonces aquí hay un ejemplo, por ejemplo, este de abajo que dice ISP informa
so
reacciones asociadas
this
al
is,
tratamiento de fibrosis
these are
quística
informations
por
that are
glicosilada
associated
tricótica.
to
Y
the
además
medications.
de darle esta
And apart
bajada a las
from
redes sociales,
downloading this
constantemente se
or
van
sending it to the
realizando
social
diversas
networks,
campañas
then you have diverse
para
campaigns.
fomentar, por un lado,
And
la identificación de eventos adversos a medicamentos y
here we
vacunas,
have
por
adverse
otro lado,
sales and events,
informar de la existencia
and
del Sistema
informing the
Nacional de
existence of the
Farmacovigilancia y
National
Registro de
Pharmacovigilance
Investigación de
System
Medicamentos. Y
and the
aquí hay una
Medications
imagen
Information
de una
Center.
de las
And here's an
últimas, me
image
parece
of
que
one
fue el
of
año
the last
pasado,
ones, which
de
was
la
last year,
campaña del Med
of
Safety
the
Week en
Med
la
Safety Week that was
bueno,
released by UMC.
no me quedaron aquí pues,
So
los iconos,
here
pero la invitación era
I
que
don't have the
igual
icons,
pudieran
but
seguir
the
las redes
invitation is for
sociales
de
de la
everyone to
Comisión de Salud
follow
Pública. Tenemos presencia en
Public Health
prácticamente
Institute,
todos
and
los
we have presence
Facebook,
in almost
Twitter,
all
LinkedIn,
social networks, Twitter, Facebook,
Instagram,
LinkedIn,
etc.
Instagram, etc.
Y dándole un poco la bajada al
So
impacto que puede tener en la comunidad, si bien
here
pueden parecer
in the community, we
ejemplos,
have the impact, and it
digamos,
seems to be an
pequeños de
example,
un
a
caso,
small
yo
example,
considero que tiene un
and
impacto gigantesco.
it is
Los
considered to have a
sliders
huge
anteriores les
impact.
mostraba
So
la información de la nota informativa de las reacciones adversas
here
dermatológicas de ibuprofeno,
we have the adverse
publicada en la
reactions
página
to
web, publicada en
ibuprofen,
diversos medios
and
de
they were posted
comunicación
on the
tanto
website and
digital
several
como
other media, digital
televisivo,
and
¿cierto? Y
televised.
posterior a eso, esto
And
fue en el mes de junio,
this was in the
mayo,
month
junio,
of June,
posterior a
May,
eso recibimos una
and then we
comunicación
received a
de público
message
general donde una
from the
mamá
public at
notificaba
large
que
of
una
a
niña se les
mother
presentó en su hijo de
notifying an
11
adverse
años
effect that was
que una reacción alérgica severa
that
por
happened with an
glicosilada,
11-year-old
días después
and with
hospitalizada
severe
por
reactions,
el uso del
and
ibuprofeno.
it
En
was
vez
the
de
use of
dar con un
ibuprofen.
dolor de
So
garganta, se le dan varias
uh,
dosis de
they
ibuprofeno
have a
en un
throat ache,
lapso
they
de
have
2
several
días.
doses of
Empieza con esta
ibuprofen,
reacción
and they
alérgica que
start
no
with this
se
allergic
resuelve
reaction,
espontáneamente.
and that's
La
not
mamá
solved
los
spontaneously.
llevó a
The
2 o
mother
3 centros
took him
asistenciales
to
y se le sigue
3
administrando
assistance centers, and
ibuprofeno
they
al
still
niño
gave him
hasta que una amiga
ibuprofen
de la mamá
until
le
a
dice,
friend
oye,
of the
pero
mother said,
¿no será el
well,
ibuprofeno el que le está
I don't know if
causando
it's the
efecto a mi hijo? Es
ibuprofen
que
that's
yo
causing
vi
this.
en la
I
televisión, yo vi
saw
en la
on
prensa
television,
que el
I saw on the
ibuprofeno puede
press
causar
that
reacciones
ibuprofen could
adversas,
cause
reacciones
adverse effects,
alérgicas. La mamá le
allergic
comenta
reactions.
esto al
And the mother
profesional de la
says
salud que
this
está,
to the
al
health
pediatra que
professional,
está
the
atendiendo a su hijo.
pediatrician
La
that
pediatra le
is
dice,
caring for the
este
child,
relato
and
textual de la
says,
mamá,
well,
le dice, es muy raro
the
que
mother
sea el
says, well, that's
ibuprofeno,
very
pero
strange that it's
quizás pueda ser.
ibuprofen, but it could
En
be.
resumen, con
So in
ese
summary,
comentario que le hace la amiga a
from
la
that
mamá, la
comment,
mamá a la pediatra, dejan de administrar
then
ibuprofeno al
they
menor,
stop
se le
giving
hacen una serie de
ibuprofen.
exámenes para
So
descartar alguna virus, alguna infección que estuviera causando este
they
compromiso
have this
dermatológico y
commitment,
finalmente
this
una biopsia
dermatological
lo que
commitment, and the
concluye
biopsy
que esos
concluding
hallazgos
that
son
these
sugerentes de una
findings
reacción
are
adversa medicamentosa. Entonces
suggestive
ahí
of
podemos, es
an
una
allergic
foto
reaction.
del
So
menor,
there's a
podemos ver un
picture
poco
of
ese
the minor. You
impacto
can
que puede
see
tener
the
la
impact that this may
comunicación de
have
riesgo. Y
in
para ir
these
finalizando,
communications.
me
And to
queda algún
close,
tiempo,
at the same
un
time, we
ejemplo
have
contrario,
an
un caso
example
contrario,
of the
donde recibimos
contrary,
una
where we
notificación
received
en un
notification
menor con el medicamento Montelukast de
with
reacciones
the
adversas
medications and adverse reactions
psiquiátricas
psychiatric, and we have reviewed our brochures with medications, with the medications at international level, and we've indicated that our brochure was not updated for several of the records we have in the country. So the records or the brochures or FDA or other entities had included a very good description of the psychiatric effects of this medication, but this case came out for review of the medication of the brochure, sorry, and also with the active principle and updating the information brochure. And then this led us to conduct a new informative note.
When we received this case, we didn't have the direct notification of the patient yet. In this case, the mom contacted the holder of the health registry of the product, and through them, we got the notification and we took these measures. And here we have some examples of our bulletin where the clinical case was communicated. And even though this is not the main topic, I need to talk about cosmetics and cosmetic surveillance. And for the past few years, the Public Health Institute has done great efforts to boost product safety of cosmetic products. We are, first of all, focused on delivering information to the population on the correct and safe use of products, because there's a false belief that cosmetics have no risk. And here we have an example of what happened with toothpaste that have strange fluoride, specifically a Colgate brand that we already know was recalled in several countries in the region, where we're using the same strategy for medication and pharmacosurveillance. And we sent this to these partners in the media, and we replicated this. And to close, I think that it's worthwhile to remind you of what is bringing us together nowadays. And pharmacosurveillance is a responsibility of all of us. We all have the power to make medications safer, and each one of us in the roles that we have this responsibility, and we can contribute our little grain of sand to guarantee that the medications that our population receives are safer and have minimum adverse effects, and to have greater benefits. So thank you so much.
Doctora Vergara, le agradecemos profundamente
Dr. Vergara, we want to thank you for your contribution and your intervention, and we ratify the admiration towards the Public Health Institute of Chile, and for all the wonderful work you do in the country. Some beautiful messages that you've left us with. For example, people are the reason why we do what we do. And you were highlighting the importance of the caretakers, and I think it's important to keep involving caretakers in these processes and in permanent training, health professionals, community pharmacies, record holders. And I also want to highlight the informative notes and the alliances that exist with the media to better involve society in these processes, and the invitation to all the colleagues, so that, as you were mentioning, they follow the social media of the Public Health Institute and can stay informed. If anybody has any questions, you can ask them directly through the chat, and we will keep moving on with today's agenda. Dr. Vergara, once again, thank you so much for being here with us today. Thank you for the invitation, Diego. We now want to go to our discussion panel called Multisectoral Dialogue for Collaborative Pharmacosurveillance, Patients, Physicians, and Industry in Action, which will be moderated by my colleagues José Bautista and Diana González. With over 15 years of experience in the global pharmaceutical industry, José has led and supervised pharmacosurveillance unit and companies like Pfizer, Merck, SK, and manage operations in over 20 countries. He's a certified global auditor, and he has participated in audits and inspections for agencies like FDA, EMA, Visa, Invisa Copepris, INVIMA, BMIT, and SPP. And he's an international expert in pharmacosurveillance and good clinical practices, the founder of Pharmacovigilance, and he has been invited to this
ISO y el World Drug
in
Safety.
Costa Rica, and he's also worked in
Diana
DIA,
es
ISOP.
médica
And
con
Diana
máster en
is a
Administración de
physician with
Empresas de Salud
masters
y actualmente
in business
estudiante de Derecho
administration and
Médico.
health, and
Cuenta
she
con más de
currently
13
studies
años de experiencia en
medical law.
farmacovigilancia y
She has
seguridad
over
de
13
pacientes.
years of
Es
experience in
Safety
pharmacosurveillance
Lead
and
para
patient
Roche
security.
Colombia,
She works for Roche
Pharmacovigilance
Colombia.
Policy Lead
She's the
LATAM para Roche
pharmacovigilance
y
policy
líder del
lead
grupo
for
de
Roche and the
trabajo de
leader of the
farmacovigilancia
working group of
de FIPHARMA.
pharmacosurveillance of
Quiero
FIPHARMA.
agradecerles,
And I want to
estimados
thank
Diana y
my
Josué, por
dear
aceptar
Diana
esta
and
invitación.
Josue
Ellos se van a encargar de
for
presentar a los
accepting this
panelistas. Así
invitation.
que, colegas,
They
los
will be in
minutos para
charge of
ustedes.
presenting the
Adelante, por
panelists. So
favor.
colleagues, the floor is yours.
Hola, hola a todos y buenos días. Yo
So,
hoy tengo el
hi
honor de
everybody.
estar con mi gran amigo
I
y
have the
colega
honor to be
Josué
here with my great
Bautista
friend and
y
colleague
con
Jose
todos estos
Bautista,
151 farmacovigilantes,
and
ya
with these
152 con Josué,
151
dos
people
sesiones
working in
iniciales de
pharmacosurveillance.
lujo.
We
Fede y la doctora
had
Verónica,
two
creo que dieron
wonderful
toda la antesala para lo que
interventions,
se viene en
Freddie and
los
Dr.
próximos
Veronica,
minutos. No sé
who
tú qué piensas,
opened the
pero yo
doors
creo
to
que esta
what's coming in the
mesa
next
va
few
a
minutes.
ser
I don't know what you're thinking about.
impresionante y es la mejor manera de abrir la
Uh,
semana
and
Med
this
Safety
is the
Week en
best
América Latina.
way to open the Med Safety
Sin
Week
duda
in Latin
alguna,
America.
Dianita, esta mesa nos
Of course,
habilita justamente el poder
this
encontrar esto que hemos venido
group shows
construyendo
us that we
y
can
que
find this,
seguimos
that we've
buscando
been
dentro del
building,
marco del Med Safety
and that
Week.
we are
Así es
still
que
looking
muy
for within
contento
the
de estar
framework of
aquí.
the Med
Gracias
Safety
a
Week. So I'm
FIPHARMA
so
por la
happy to be here.
invitación y
Thank you for
sobre todo,
FIPARMA for the
gracias
invitation.
por permitirme
Um,
compartir este
and
espacio
thank you
con
for
gente
allowing
tan
me to
querida,
share
tan
this
admirada, pero sobre
space
todo
with
tan
people who
respetada
are
como
so
son ustedes.
nice and admired and respected like you.
Eso. Y bueno, ¿qué te parece, Josué, si hoy estamos
So,
viendo ya en
Josue,
pantalla
today
a
we're
estos
seeing on
4
screen
panelistas?
these
A mí
wonderful
ya la verdad me
panelists,
están
and
dando ansias de
I'm
escucharlos.
so anxious
Tenemos
to hear
algunas
from them.
preguntas que nos van a
We have some
facilitar.
questions
¿Y
that
qué te
will
parece si
make our
empezamos
lives
a
easier.
introducir
And should
quiénes
we
van a
start
estar esta mañana
introducing
con nosotros
who
en esta
will be
conmemoración de
here this
América
morning with
Latina y
us
de
in this
FIPHARMA en el Med
commemoration of Latin
Safety Week
America
del
and FIFARMA
2025?
and the Med Safety Week of
Fantástico,
2025?
perdón. Vamos a
Fantastic.
iniciar con
We're
esta
going to
presentación
start with
y
this
permítanme
presentation,
comenzar con
and allow me
traer
to
aquí
start
a
by
este foro
bringing here
la
to this
introducción
forum
de Edgar Ismael
the introduction of
Domínguez, quien
Edgar
es
Ismael
jefe del Departamento de
Dominguez. He's the head of the
Farmacovigilancia de la
Department of
Dirección Nacional
Pharmacosurveillance
de
of the
Farmacia
National
y
Directorate of
Drogas en
Pharmacy and
Panamá.
Drugs in Panama.
Él tiene más de 18 años de
He has over
experiencia con la
18 years
regulación de
experience
medicamentos,
with medications
farmacovigilancia y
regulation,
promoción del uso
pharmacosurveillance,
racional
and
de
promotion of
fármacos.
the rational use
También posee una
of
maestría
drugs.
en
And he also
farmacovigilología con
has a master's in
farmacovigilancia y como ya lo
pharmacosurveillance and
mencioné, actualmente
epidemiology. And as
se
I mentioned,
desempeña como el
he currently
líder de las
works as
operaciones
the
de
leader of the
farmacovigilancia en el Ministerio de Salud de
pharmacosurveillance
Panamá,
operations in the
donde es
Ministry of Health of
responsable
Panama,
de llevar a
where he's
cabo
responsible
la
for
gestión,
carrying out
administración y
the
liderazgo de
management,
programas y
administration, and
estrategias clave
leadership
que
of programs and key
nos
strategies that
permitan
allow
llevar a
us
cabo el monitoreo
and
de
that
la seguridad de
allow
los
carrying
medicamentos,
out the
así como
monitoring of
fortalecer el
medication
sistema
safety
nacional de
and
este país tan
strengthening the
querido como
national
es
system of such a
Panamá,
dear
de tal forma que
country
se
like
pueda
Panama.
garantizar la
So,
seguridad, la
in such a
eficacia
way
y
that they
la
can
calidad de
guarantee
los productos de salud
safety,
humana
efficacy,
en
and
este
quality
muy,
of
muy
human
bello
health
país.
products in this
También,
beautiful,
por
beautiful
supuesto,
country.
hablar de medicamentos
Also, talking
es
about
hablar de seres
medications
humanos,
means
es hablar
talking
de
about human
pacientes y
beings and
por ello, de
patients,
manera muy
and
afortunada,
therefore,
muy
we are
atunada y sobre
very
todo muy
fortunate
virtuosa, contamos
um,
con la presencia de
to have
Yesid
the
Parra
presence
Cuervo.
of
Él
Yesid
es
Parra
representante de
Cuervo.
pacientes
He
en
is
un
the
comité de
representative of
ética e
patients in an ethics
investigaciones
committee
dentro del
for
Instituto
research
Nacional de
within the
Cancerología
National
allá en
Cancer
la
Institute
tierra de el rico café y sobre
in
todo
the
de Andrés
land of
Carne de Res
coffee and Andres
en
Carne de
Colombia.
Res.
Yesid
So
es un
Colombia,
superviviente
Yesid
del
is
cáncer y
a
líder en la
cancer
humanización
survival,
de la
and he's a
atención en
leader in
salud. Pues
humanization of
representa
health
a estos
care,
actores
and he
primarios que
represents
somos
these
todos y cada
primary
uno de
actors, and
nosotros,
which
que
are all
son
of us,
los pacientes,
like
cuidadores y los
patients and
participantes en este
caretakers
ámbito
and
de la atención en
participants
salud.
in this
Esta
environment of
representación
healthcare.
la lleva a
And
cabo en
this
diferentes
representation,
mesas técnicas
he carries it
sobre
out in
todo en el
different technical
contexto de la
tables,
atención
especially
en
in the
salud y
context
sobre todo de la
of
investigación
healthcare
clínica en
and
Colombia. Y
clinical
durante más de una
research in
década, pues
Colombia.
ha
And
sido
for
un
over a
promotor
decade, he
incansable
has
acerca de
been
la ciencia con
promoting
conciencia,
science
guiada por
with
la ética, la
consciousness,
integridad
guided by
científica y
ethics,
sobre todo,
scientific
y más allá,
integrity,
y más importante,
and
el
especially
respeto a
and
la
most
dignidad
importantly, the
humana.
respect
Bienvenido, Yesid.
for human
Y
dignity.
sin lugar
Welcome,
a
Jessid.
duda, el
And
ecosistema de
undoubtedly, the
farmacovigilancia tiene que
pharmacosurveillance
tener
ecosystem
un
has to have
actor fundamental que
a
es todos
fundamental
estos
actor
profesionales que
who are
representan
all
la
of these
academia y el
professionals that
sector
represent the
hospitalario.
academia
Y yo
and the
tengo el
hospital
honor de
sector.
presentar a la
And I have
doctora
the honor
Liliana
of
Vargas. La
introducing
doctora
Dr. Liliana
es la
Vargas.
jefe
Dr.
del Departamento
Liliana
de
is the head of
Farmacoepidemiología del
the
Hospital Infantil Federico Gómez allá en
pharmacoepidemiology
tu país,
department of
Josué, en
Hospital Federico
México.
Gomez in
La
your country,
doctora
Josue, in
es
Mexico.
química farmacéutica con
She is a
maestría en
pharmaceutical chemist. She
farmacología,
has a master's
doctorado en
in pharmacology and a
epidemiología, perdón,
PhD in epidemiology.
clínica y actualmente está
And
dirigiendo
she's currently directing this department at the hospital. She is a pharmacosurveillance professor at UNAP and Universidad de La Salle. She's currently the president of the Latin American chapter of ISOP, and she's member of SNI with a wide trajectory. She is a representative in Latin America of pharmacosurveillance, and not least important, I also have the honor of introducing my colleague Francisco Sierra. He's currently a pharmacovigilance lead for Colombia, Ecuador, and Venezuela, also representing an important stakeholder in the pharmacosurveillance and in the scope, the pharmaceutical industry. He's part of the PHIPHARMA team. He's a physician with studies in public health, health economy, pharmacoepidemiology, and pharmacosurveillance. Francisco has broad trajectory working at government institutions, regulatory entities, and pharmaceutical companies where he has addressed the access to health technologies, and especially, I think, is a great representative of pharmacosurveillance. Currently, Francisco is a member of the planning committee of the campaign in Latin America and with the Association of Pharmacosurveillance. So we have all the stakeholders of the networks and everything that brings together a pharmacosurveillance network. And before we start, I want, in welcoming our panelists, I want to do a quick reflection that we were talking about with you when PHIPHARMA invited us to start this table. And it's that today, more than ever, Josue and all our colleagues who are connected here, medication safety demands something more than just technical knowledge. It requires active listening, genuine collaboration, and a shared commitment. And this space was born from a deep conviction in the Federation on patients and physicians and the industry that are not separate pieces, they are allies in action. So I believe that this is the best way to start with this key, allies in action. What do you think?
Totalmente de acuerdo y
I
en ese
completely
sentido,
agree. And in
me
this
parece
same
muy
order of
importante
ideas, I
resaltar
think it's very
esta
important to highlight
conexión que tú
this connection
mencionas
that
muy
you were
bien, porque
mentioning and
sin duda
mentioning very
alguna,
well, because
cuando cada voz se
undoubtedly,
integra, cuando
when
cada
each voice is
experiencia se
integrated,
valora,
when each
la
experience is
farmacovigilancia
valued,
deja de ser un sistema,
pharmacosurveillance
deja de ser
is
un
no
ente
longer a
técnico,
system or a
un ente
technical
conceptual
entity,
y se
a
convierte en
conceptual
una
entity, and
verdadera red
becomes
viva,
a true
dinámica y
living
efectiva
network that
que
is
brinda
dynamic and in
protección,
constant evolution, that
aprendizaje y
provides
sobre todo
protection
bienestar
and
a
learning
las
and
y los
especially
pacientes. Así
well-being
es
to
que, pues
patients.
vamos a comenzar,
So let's
vamos
start.
a iniciar con esta
We are going
conversa
to start
para
with this
poder construir
conversation so that
justamente
we
los
can
puentes que
build
bien
the
necesitamos
bridges
en
that
este
we need
espacio
in this
de la
space
protección a la salud de los
of
pacientes y sobre todo para
protection to
reconocer
patient
algo
health, and
bastante
especially to
importante,
recognize one
que
thing that's
todos y
very,
cada uno
very
de
important,
nosotros
that
tenemos
each
el
one of
honor
us
y sobre
has the
todo el
power
derecho
and the
de hacer que
right
los medicamentos sean más
to
seguros.
make medications be
Y
safer.
en este contexto, qué
And in
mejor
this context,
que iniciar este panel
what better than
dándole
starting
la
this
voz
panel by
a los
handing the
pacientes.
floor to the
Así es que me
patients?
gustaría iniciar
So I would like
contigo,
to
mi
start with
estimado
you,
Yesid,
my
bajo
dear
este primer
Jessie,
planteamiento.
under this
Una de las
first
principales
statement.
fuentes
And
de
one of the
información de la
first,
seguridad de los
the main
medicamentos, sin
sources of
duda alguna,
information for
somos los
medication
usuarios,
security
son los
is the
pacientes.
users,
No
the
importa
patients.
si es serio o
It
no
doesn't
serio,
matter if
conocido o
it's
no
serious or
conocido,
not, if
todos
it's
los datos
known
de
or
seguridad
not.
aportan algo muy
All
importante a
security
este
or safety
conocimiento en
data
materia de la salud
contribute
pública.
something that's
Por lo
very
cual
important
nos
to public health.
gustaría
Therefore, we
solicitarte
would
muy
like to
amablemente,
request very
Yesid, si nos
kindly,
pudieses
Jessie,
compartir
if you could please
desde
share
la perspectiva del paciente,
from the patient
¿cuáles
perspective,
son las situaciones o los
what are
escenarios
the
que consideras
situations
como
or
las
the scenarios
principales
that you
barreras
consider
que aún
like the
existen
main
para poder
barriers that still
hacer
exist
una realidad
to
un
be
sueño
able
posible, que es el
to
reportar
make
reacciones
to
adversas?
have
¿Y
a dream become a
cómo has
reality, which is
observado,
reporting
cómo tú
adverse
visualizas que podemos
events? And
superarlas
how
de
do you see
manera
that we can
conjunta
overcome
trabajando en
this
equipo?
jointly, working as a team?
Bueno, buenos días para todas y todos. Un placer estar aquí con
Welcome,
este
everyone. It's a pleasure to
magnífico
be here
equipo.
with such a great
Y
team.
más allá es
And
el reconocimiento
beyond this,
a la
it's the
figura tan importante
recognition
como
to
lo es la
such an
ciudadanía.
important figure like
Porque
citizens,
creo que es que una de las
because I think
principales
that one of the
barreras que
main
voy a aportar
barriers
acá
that
es
I'm
la
going to state
armonización del
here
lenguaje
is the
o la cultura
harmonization of
de
language
lo
or the
que se conoce
culture
como el
of what is
medicamento
known
seguro, más
as a
allá,
safe
como
medication,
dije la doctora
beyond,
Diana
as
González,
Dr. Diana
que
Gonzalez
la
mentioned,
expresión
that
farmacovigilancia
the
no es taquillera.
pharmacosurveillance
Entonces,
expression doesn't
es
really sell.
importante también entender que la primera
So
barrera
it's important to understand that
a
the
la que
first
nosotros nos
barrier that
enfrentamos
we
es que no
face
tenemos
is
claro
that
qué es,
we're not
¿sí?
clear on what it
Porque pues
is, because
empecemos por la misma
let's
definición
start by the actual definition.
del medicamento. ¿sí?
of the
He
medication.
tenido la oportunidad
I've had
de
the
estar en
opportunity
diferentes
to be
congresos
in
de
different
la región, digamos, de México
conferences in
para
the
abajo,
region from Mexico and
y está
downwards, and
he identificado
I've
que pues muchas
identified
de las
that
palabras no
many
son
of the
claras
words
para
are
nosotros
not
como
clear,
sociedad,
not
porque a
even for us
nosotros
as a
nos hablan en
society,
unas
because
partes de
they
moléculas, en
some
otras
parts talk
partes
about
nos hablan
molecules, some
de
parts talk about
medicamento, en otras partes nos
medications,
hablan de
some parts talk
fármaco, en
about
otra parte nos hablan de drogas, en
pharmacosurveillance or
otra parte
drugs
nos dicen pastillas.
or pills.
Entonces,
So
creo que una de las
I
principales
think one of
retos
the
es
main
cómo logramos
challenges is
la
how
armonización.
are we
Y
able
si
to
a eso le
harmonize
sumamos
this?
un
And if
componente que es
we add to
muchísimo
this
más
a component
importante,
that
es
is
que no
much more
tenemos
important,
claro
and it's that
qué
we're
es,
not
o sea, no
clear
tenemos claro qué es un evento adverso,
what an
qué es un
adverse
efecto
event
secundario,
is, what is
¿sí?
a side
Entonces,
effect.
si yo no tengo claro
So
dentro
if
de la
I'm not
misma
clear
armonización, pues
within
no puedo realmente decir
harmonization,
esto que me
I
está
cannot
pasando,
say that something that's
cómo
happening
lo
to
puedo
me,
establecer, ¿sí?
I could
¿Qué es
establish it
lo
this
que
way or
es
that way. So
digamos, lo común? Lo común
what's
cuando uno
common
está en las salas de
when
espera
we're in the
de los
waiting
centros
rooms
asistenciales.
of
¿Cómo
hospitals?
acá en Colombia decimos nosotros,
Here
cómo
in
le
Colombia, we
sentó
say,
el medicamento? ¿Sí?
how did you
Es
feel
como
with the
cómo
medication?
lo
Like, how
deja,
did it make you
que de pronto ha
feel?
sentido diferente
What have you felt
el consumo del
differently
medicamento.
with the
Entonces creo que
medication?
para mí
So for
y en
me,
general como
and in
sociedad, creo
general,
que
as a
también el
society,
reto grande es
I
cómo
think that
logramos
the
esa
big challenge is
armonización del
how are we
lenguaje y
able to
ese
have this
entendimiento
harmonization of
natural
language
de lo
and
que
this
está
natural
pasando.
understanding of what's going on.
Mira qué importante eso, Yesid,
This is
y
so
te damos
important, Jesse,
gracias por
and we
empezar
thank you
esta
for
celebración
starting this
dejando claros sus
celebration by
mensajes, ¿no? Como dónde,
making these
cómo
messages
y de qué
clear. So
manera trabajamos
where, how
articuladamente todos los que
can
debemos
we
poner los puentes para que
work,
ustedes, los pacientes, y
and
nosotros
what
cuando
can we
somos
bridge
pacientes,
so that you
sepamos
as
dónde
patients
y
and
cómo
we, when we
reportar.
are patients,
Y yo
know
quisiera
how and
continuar
where to
este
report this?
conversatorio
And I would
invitando
like
al
to continue
doctor
this
Edgar
conversation by
Domínguez,
inviting
quien tuve
Dr.
el honor de
Edgar
conocer
Dominguez,
hace unos
that I
pocos
had the
meses. Doctor, le
honor of
agradecemos
getting to know a
mucho que
few
esté
months ago.
acá con
Doctor, we're so
nosotros.
thankful for you
Y yo
being here
quisiera
with
hacer
us.
esta
And I
pregunta a
would like
usted
to
dando un
ask
poco de
you this
contexto. Y
question, giving some
sabemos que
context.
la Dirección
We
Nacional de
know that the
Farmacia
National
y Drogas de
Directorate of
Panamá ha sido un
Pharmacy and
referente en la
Drugs of
región
Panama
de
has been a
Centroamérica y el
reference in the
Caribe
region of Central America
en
and the
materia de
Caribbean
transparencia y
in
vigilancia
regards to
sanitaria. Los
transparency
que
and
tuvimos el
health
honor de escucharlo hace
surveillance.
unas semanas
Those
a
of us who
usted,
had the
nos
honor
dimos
of
cuenta ese
listening to
esfuerzo
you a
que está
few weeks
haciendo
ago
Panamá
realized about the
y
effort
todos
that
estos
Panama
actores que están
is doing and all
movilizando
these
para
actors
hacer
that are being
farmacovigilancia.
mobilized for
Dicho eso,
pharmacosurveillance.
doctor, yo quisiera
Having said that,
preguntarle
doctor,
cómo
I'd like to
promueve la
ask you,
agencia
how does the
participación
agency
activa de los
promote active
profesionales y los
participation
pacientes
of
en la
professionals and
notificación de
patients in the
reacciones adversas,
notification
a
of adverse
propósito de lo que
reactions,
nos está comentando doctor
uh,
Yesid en este momento?
considering what Jesse is also mentioning?
Hola, buenos días a todos. Muchas gracias por
Well,
la
good
invitación a
morning,
FIFARMA, al
everyone.
doctor
Thank you so
Salas.
much for
Muchas
FIFARMA for the
gracias a nuestros
invitation, for Dr.
moderadores, la doctora
Salas
Diana, el
and
doctor
Dr.
Josué.
Adriana,
Sí,
Dr. Diana and Dr.
como bien
Josue. Thank you so much for
mencionó
moderating. And
el
as
doctor Yesid,
Dr. Jacid
es
mentioned,
muy importante
it's
el
very
tema de
important
adecuar el
to
lenguaje para que los pacientes
organize
puedan
the
tener
language
el
so that
acceso a las
patients can
herramientas
have
adecuadas
access to
para generar sus
adequate
reportes.
tools to
En ese
generate the
sentido, la
reports.
Dirección Nacional de Farmacia y Drogas, desde
In this
que
sense,
comenzó
the National Department of
trabajar en el fortalecimiento del
Pharmacy
Sistema
and Drugs,
Nacional de
since it started working
Farmacovigilancia,
on the pharmacosurveillance strengthening
aproximadamente desde el año 2001
process,
que inició
approximately from
ese trabajo,
2001, that
se
this work
incluyó a los
started
pacientes
and
dentro
included the
de ese
patients within
sistema
the
de
system of
farmacovigilancia. Se creó un
pharmacosurveillance.
formulario
We
especial para el
created a special
reporte
form for the
de
report
pacientes adecuado
of
al lenguaje de los
patients
pacientes,
adequate
porque
to the
entendemos que hay
patient's
muchos
language,
términos que son
because we
técnicos
understand that
dentro
there
de
are a lot
los
of terms that are
formularios de
technical
reporte que
within
están
the report
destinados para los
forms that are
profesionales de la
destined
salud.
for
En
the
ese
health
sentido,
professionals.
hicimos un
In that
formulario
sense, we did
en
a
un lenguaje
form
mucho más sencillo,
in a much
más
more
comprensible
simple
para los
language,
pacientes,
much
para que los mismos
more
también pudieran
understandable
hacer
for
sus
patients
reportes,
so that
no
they could do
utilizando
their own
tantos
reports,
términos
not
técnicos
using
que
so many
entendemos que al
technical
final
terms
nos
that we
pueden
understand
confundir,
that
¿no?
at
La
the end
diferencia entre fármaco,
could
molécula,
confuse like the difference between
medicamento, que
medication
sabemos que hay ciertas
and drugs and molecules,
diferencias
and we know
entre
that
cada
there
uno de
are
esos
certain
términos,
differences
¿no?
between these terms.
Entonces, se buscó
So
esa estrategia, ese
we have
formulario
this
se validó
strategy,
con
this
asociaciones
form
de
that was
pacientes
validated
para
with
que los
patient
mismos nos ayudaran
associations
entonces a esa
so that they would
retroalimentación,
help
¿no?
us with
Porque
the feedback.
inicialmente trabajamos un borrador y ellos
Because
nos
initially
ayudaron
we worked on a
a
draft
adecuar el
and they
mismo.
helped us
Otro aspecto que
organize
también
it.
nosotros buscamos
And
es
another aspect that we were looking for is in the dissemination of information, and we generated the
que
safety
se
notes
generan a través de los
that
reportes
are
que
generated
recibimos
through the
o de
reports
la
that we
monitorización
receive
internacional que hacen otras
and through
agencias, ¿no?
the
Entonces, dentro
international
de esas notas de
monitorization
seguridad siempre
from
buscamos
other agencies.
incluir
So within
un
these safety
acápite
notes,
dirigido a los
we are able
pacientes,
to
a los
include something
consumidores,
for patients,
a los
for
cuidadores
consumers,
también, que es muy importante,
for
¿no?
caretakers.
Con un lenguaje
Um,
mucho más comprensible sobre el tema que se está comunicando. En este caso,
and
si es una nueva señal
for
de seguridad de
example,
un
if we're
medicamento, una
communicating a
reacción
new
adversa, que haya
security
dentro de
sign for
esas notas de
medication or an
seguridad que
adverse
se
reaction, to
comparten y
have
se
within the
publican
safety notes
una
that are
información
shared
en
and
un
published
lenguaje mucho
an
más entendible
information in a
también
much more
para el
understandable
grupo de los
language
pacientes, ¿no? Sabemos
for
que muchas veces se
the
enfoca
patient groups.
principalmente en los profesionales de la salud, pero también
And this
buscamos que
it is
haya ese
focused on
espacio
health
para los
professionals.
pacientes.
But we seek to have this
Muy
space for
interesante el
patients.
planteamiento, mi
It's such an
estimado Edgar,
interesting
que nos
statement,
compartes y sobre
dear
todo muy
Edgar, that you're
alineado
sharing, and
a
very much
esta
aligned
idea y sobre
to
y
this
reflexión que nos
idea
hacía Yesid de
and
qué
this
tan importante
reflection
es
that
poner
Yasid
a
was making
disposición de
of
la
how
población en
important do you
general
think it is to
instrumentos que
put
sean entendibles, pero
available
sobre
for the
todo
population
sensibles
instruments that are
a las
understandable,
necesidades y a las
uh,
imperativas y los retos que como
and
pacientes
also
vivimos en este
so that we
proceso
can
de
know
uso
about
de los medicamentos.
the
Gracias,
challenges that us
gracias
as
Edgar.
patients that we have to go through with
Siguiendo
the
tu
use of
orden de ideas y
medications.
continuando
In
con
this
este
order of
diálogo,
ideas,
pues sabemos
continuing with the
que el
dialogue
reporte
table,
de información de
we
seguridad como
know
las reacciones
that
adversas o
the
los
security
eventos adversos,
report,
pues es
like
una
adverse
piedra
events,
angular para poder fortalecer esta información de seguridad de los
to be able to
medicamentos.
establish the
Sin embargo,
information,
pues
the
también
security
aquí hemos
information
sabido
of
que
the
en la
medications.
práctica
However, we
clínica
do
hay
know in the clinical
múltiples
practice that
factores que
there are
pueden
multiple
influir en que
factors
este
that can
reporte suceda o no.
have an
Y
influence on
desde
the
una
fact that this
cultura
report happens or not.
institucional,
And from an institutional
puede
culture,
considerarse la carga de
um,
trabajo, pasando por
we
esta
can
percepción de valor que le
consider
podemos dar
like the
al
burden
proceso
of the
de
work
reportar un
and the
evento
value that
adverso.
we can give
Aquí
to the
todo
process of
cuenta.
reporting
Por
an
eso me
adverse
gustaría
event.
ahora
So
convocar a esta
I
conversación
would
a mi
like to
querida
bring to this
compatriota,
conversation
colega y
my
amiga
dear
Liliana Vargas
colleague
Neri
and friend
para
Liliana
que
Vargas
nos
Neri,
pudiese complementar en
so
este
that
sentido en el marco de la
she could
práctica
complement in this
clínica,
sense within the
qué
framework of the clinical
estrategias han
practice,
resultado más
what
efectivas
strategies
para
have
poder
turned out to be
fomentar que
more
los profesionales
effective
de la salud
so that
sean parte
healthcare
de
professionals
este
can be a
proceso
part
derecho
of this
del reporte de
process
reacciones
of a
adversas, Lili.
report of adverse
Muchas
events.
gracias, Josué. Muchas
Thank you so
gracias,
much,
Diana, Diego,
Josue,
por la invitación.
Diana, Diego, for the
La verdad es que es un
invitation.
honor estar acá con excelentes
It's an honor to
expertos
be
en
here
el
with
tema y
excellent
sobre todo por
experts,
sumarnos, ¿no?
um,
a este Med Safety
and
Week que es
especially
muy
for adding
importante
to
no
this
solo
MedSafety
para
Week.
nosotros como profesionales, sino también queremos que sea importante para los
And for us as
pacientes y la
professionals,
población en
and
general.
we want
Y
this to
en
be
verdad
important for patients and for
este esfuerzo
population
de
in
hacer este
general.
evento pues es
Um,
parte de concientizar a
and
todos,
this
¿no?
is part of
Y
creating
bueno,
awareness for
un gusto
everybody.
estar acá.
And it's a
Y
pleasure
bueno,
to
pues
be here.
sumándome a
Um,
esta conversación y respecto a esta
and adding
pregunta
on to this
que mencionas,
conversation,
como bien
and
dijiste,
this
tenemos que conocer
question that you're
primero
mentioning, we want to get
cuáles
to
son
know
las
first
causas del no
what are the
reporte, ¿no?
cases of the
De que los
non-reporting.
profesionales no estén reportando. Y bueno, pues las
Why are the
encuestas
professionals not
siempre
reporting?
para los profesionales de
And
la salud
surveys
han
for
sido constantes
healthcare
situación de las
professionals have been
respuestas
constant in
de
regards to
que
the
hay factores humanos,
responses
¿no?
that there
Uno
are
es la
human
carga
factors.
laboral que presentan, otro es el
One
miedo
is
a
the labor
notificar,
burden, the
otro
other
es
is the
el hecho de
fear to
que lo
notify, and the
perciben
other is
como
the fear to
un
be
efecto
perceived
nulo, ¿no? Al
as
final del
a
día en el
null
reporte,
effect
¿no?
at the
Decir,
end of
bueno,
the
pues, ¿y
day in the
qué
report,
gano o qué va a
and
pasar
saying
si
like,
reporto o no reporto? Pues llevo toda mi
what will happen
práctica
if I report or if I
profesional sin
don't?
reportar, pues
So I
¿cuál va a ser la
haven't been
diferencia?
reporting
¿No?
for my
Entonces
entire
hay una
life. So what's the
percepción y
difference?
hay
So there's
unos
a
factores
perception and
humanos
there are some
bastante
human
importantes que
factors.
tenemos que tomar en cuenta si es que
And there are
queremos
important
establecer
factors that we need to
estrategias
consider if we
para
want to
mejorar la
establish strategies
notificación.
to improve
Entonces, en este
notification.
sentido, hablando de los
Um,
factores humanos, es necesario
and in this
no
sense,
solo
talking
tener
about
una
human factors is
capacitación
necessary not just to have
continuación, también
continuous
llegar a esta
training,
concientización,
um,
¿no?
but
Y
also
aquí quiero
reach
hacer la
this
diferencia, o sea,
awareness.
yo puedo estar
Um,
capacitando a los
I can be
profesionales,
training
pero si no tengo
professionals,
esa emoción
but if I
o
don't
ese
have this
sentido de
sense of
pertenencia hacia la actividad,
belonging
definitivamente
towards
pues
the
lo van a ver como un
activity,
proceso
this is
más.
definitely going to be
Y
seen as
esto no
one
va a
more
tener
process,
efecto,
and
¿no?
this will not have any
Concientización se
effect.
basa más que nada en que
And
yo
this
estoy
awareness is
tocando un aspecto
based
ya
mainly off the
de
fact that I'm touching
cultura y
upon an
de
aspect of
emoción
culture,
hacia la
an
acción que yo pueda
emotion
desempeñar dentro
towards
de mi
the action that I can carry out within my
Entonces, en ese
professional
sentido, pues
practice.
las
In
capacitaciones
this
tienen que ser con más
sense,
pasión, ¿no? Con más inclusión
we need to have more inclusion of professionals. And the other one, professionals don't know what pharmacosurveillance is about. As Diana was saying, pharmacosurveillance, sometimes we want to extrapolate to different areas and people, but it's complicated to talk about pharmacosurveillance because it's a long word, first of all. And second, because it's surveillance. And when if somebody says that we're going to do pharmacosurveillance, the first question is who are you going to be doing surveillance on? In that sense, a strategy to encourage these reports or notifications is to include professionals on what to do behind pharmacosurveillance. So how do we analyze the case? How do we make decisions? What are the databases like? What are regulatory entities' roles? What is the feedback from authorities? How do we communicate with the pharmaceutical industry? And there's still a bridge to be done. Now, this communication of hospitals and health professionals, pharmaceutical industry, and authorities, we've done a lot of efforts. And this type of encouragement and awareness is still weak. And another separate thing about this awareness is feedback. Not just feedback, like, this month we had 10 notifications, and next month we increased to 15. Bravo. Okay, no. These are like the basic indicators where we have raw data, but at the end of the day, as people, when we are empathetic with the other professionals, we want to establish this motivating feedback. So that we should include them in decision making, or that pharmacosurveillance is included within therapeutic decision making. We analyze a database, and this was also published in our pharmacosurveillance committee. This was analyzed with these data. So a little bit more towards what's interesting for patients and professionals, which is decision making in the office. And another one that's also missing is recognition. And as human beings, we're also always going to look for recognition. This is innate, and health professionals also require this recognition. So, and this has happened in hospitals, including mine. It's this involvement of pharmacosurveillance within quality management systems, and also within the staff performance reviews. So if you participate in pharmacosurveillance activities, you have an additional recognition. So sometimes it's a bonus. Okay, you participate in all of this. You're going to be mentioned in an auditorium in a session. And these types of things that at the end of the day don't cost much, but give a lot of added value when we talk about pharmacosurveillance and its encouragement of notifications. Another issue talking about factors of why professionals don't notify is the process of notifications. And as pharmacosurveillance professionals, we now have to simplify processes. If we already know within the health processes that they are overburdened, that we are living in a system that practically survives. I don't think there's a hospital in Latin America that is not suffering in human resources. And the health systems in general are for infinite needs and very, very limited resources. So in this sense, we can simplify processes, get support from technology, from apps that could help simplify the process of notifications. And at the end of the day, supporting the notifier and the health professionals, so that they don't feel that it's an administrative task, but one more task of our clinical practice. And I also want to close with something else. And if we are in a collaboration and co-responsibility, we also have to encourage non-punitive culture. And if we say that our systems are not punitive,
Siempre estamos buscando,
And we're
digo,
always looking
como seres humanos, no
for, as
buscamos
human beings,
el
we're
qué
not
pasó, sino
looking
buscamos quién
for
fue, ¿no?
what
Entonces,
happened, but who did
aquí es
it.
donde tenemos que tocar base ¿sabes qué?
So
La
here we want
farmacovigilancia
to
entra como una
touch base on
gestión
the
de
fact that
calidad, pero también entra
pharmacosurveillance
para
is
prevenir, no
quality, but
para
also
estar
for
buscando
prevention,
culpables o para
but
estar
not to
buscando
look
en quién
for
equivocarse.
who to
Entonces,
blame.
es un quehacer de
And
tomar responsabilidad de todos que creo que
this is a
podría aumentar,
responsibility of all of
¿no? Los
us.
hospitales que gestionan de manera
And
adecuada
this could give feedback to the hospitals that adequately
las
manage.
notificaciones definitivamente están
And the
muchísimo
notifications
más avanzados en
are
farmacovigilancia que
very
aquellos
much
que
more
están
advanced in
buscando siempre
pharmacosurveillance
este análisis
than those who are
más
looking
hacia la
for this
culpa, ¿no? A base
analysis more
de es
towards
que o fue el
guilt.
medicamento o fue el
Or
médico,
was
no
it the
hay de otra,
medication or
fíjese.
was it the
No,
doctor?
no es así,
Basically, that's
¿no?
what they're trying
Al
to
final
do,
del día
look for
estamos
somebody to
hablando de
blame.
seguridad de
At
los
the end of the day, we're
medicamentos que
talking
se
about
van a reflejar
medication safety, and
siempre
this
en
will
la
be
salud de los
reflected
pacientes.
in patient safety.
Doctora, yo soy una gran admiradora y le voy a
Doctor, I'm a
nombrar a
great
todos los
admirer, and I will confess to
155
the 155
farmacovigilantes que están, que
pharmaco
yo creo que uno de los sueños
people
que
who
yo
work in
tengo es que
pharmacosurveillance, and
todos
one of
los
my dreams
profesionales de la salud
is that all
habláramos como usted está hablando acá hoy.
professional
De
healthcare
verdad, yo le
professionals should talk
agradezco mucho
about
eso
like the
porque
fact that we're talking
a
about
veces
today.
tenemos dos caras, como
Um,
decía, de la moneda. Y yo
so
me voy a
sometimes we have
yo le
two
dije una
sides
vez
of the
decir
same
que
coin,
pues
and I told you, see the
farmacovigilante,
ones,
perdón, uno de los doctores y doctor Edgar, pues no era tan
and Dr.
taquillero,
Edgar,
porque era
this
pues muy
wasn't
largo, ¿sí?
really a
¿Qué
famous
asocia eso?
issue.
¿Quién tiene la culpa, como decimos en mi país?
And
¿Cuándo
who
llegó
is
la
to
policía,
blame?
cierto? Y esto no es. Y
It's like,
con eso
oh,
yo
the
creo que
police is
voy a
here. Well,
invitar aquí a
no.
este diálogo,
And
trayendo
I
una
want to
reflexión
invite to
de
this
cómo se empezó a
dialogue
construir
some
esta historia de
reflections
Jessie
of
por
how
una
we started
estructura de
building this
dónde
story,
el
and Jesse
paciente,
sets the
donde
structure
el doctor
of where
Edgar
is
nos
the
dice, vea,
patient,
nosotros
Dr.
estamos
Edgar,
haciendo amigable el camino.
and like, hey,
Tú,
we're
doctora
making
Lili, nos
this
dices,
path
mire,
friendly, and
nosotros
Dr.
los
Lily, you're
profesionales nos
saying,
pasan
hey,
estas
we as professionals
situaciones y
have
no
these
reportamos,
situations.
pero yo sentí ese mensaje tuyo como un llamado a la
But
acción.
I felt this
Y
like a
con
call
eso
to
quiero invitar
action.
a mi estimado
And
colega
this
y
is
amigo
why I
Francisco
want to invite
Sierra desde
my
el rol de la
dear
industria
colleague and friend
farmacéutica con
Francisco
una
Sierra from the
pregunta,
role of the
y es que
pharmaceutical
Francisco,
industry with
yo
a question.
personalmente considero que
Um,
tú eres el
and I
profesional
consider
quien ha
that you
reunido unas
are the
expertices
professional
bien
who has
interesantes
brought
en la
together some
farmacovigilancia en esta
experiences that
región.
are very important
Y
in
desde la experiencia de
pharmacosurveillance
la
in this
industria
region. And from the
farmacéutica, la
experience
doctora dijo
of
ahorita,
the
pues no siempre
pharmaceutical
no es la
industry,
culpa
the
del
doctor
medicamento,
said
no es la culpa
that
del
it's not the
profesional, no es
medication's
la, o
fault or
sea,
the
tenemos que
professional's fault.
armonizar.
We have to
Me gustaría
harmonize.
preguntarte a ti, Francisco, bueno, desde ese rol de industria farmacéutica que
And
ahora tú
from the role
estás
of the pharmaceutical
liderando,
industry that
¿cómo
we're
se
leading right
promueve una
now,
cultura de
uh, how
corresponsabilidad
do we
con
promote
los
a culture of
sistemas regulatorios y los
co-responsibility
profesionales de la
with
salud
the
para
regulatory
fortalecer
systems
la
and the
farmacovigilancia?
healthcare
Y yo
professionals to
pondría
strengthen
como unimos estos
pharmacosurveillance?
actores el
And
beneficio del
um,
paciente.
and I would
Te
put these
agradecería mucho,
stakeholders for the
Francisco.
benefit of the patient. I would be really thankful, Francisco.
Muchas gracias por la moderación. Gracias a
Thank you,
FIFARMA por
Liliana,
la
so much for the
invitación también y a
moderation. Thank you,
mis
Fifarma, for
queridos
the
colegas
invitation.
panelistas y a todas las personas que están enlazadas.
And thank you to the panelists and everybody
Yo
who's
creo
here.
que pues desde la industria farmacéutica
I think
es
that from the
un
pharmaceutical
placer y más que todo
industry, it's a
una
pleasure and
necesidad de
mostly
estar
the need
involucrado en la
to be
celebración
involved
de la semana
in the
de la
celebration of
seguridad
the
mundial del
week
medicamento, porque esto
of
está
medication
inmerso
safety.
dentro de la
Um,
genética de la
and this is
industria
immersed
y
within
es
the genetics
poder
of the
proporcionar
industry, and it's being
medicinas o
able to provide
medicamentos que
medications
ayuden a mejorar las condiciones de salud de
that
las
can help
personas.
improve the
Y
health
para
conditions
eso,
of
pues,
people.
se hacen esfuerzos muy
Um,
grandes para que los
and there's
medicamentos
great efforts
sean también seguros.
for medications to be
A
safe.
tu pregunta de la corresponsabilidad, yo creo que
And for
pueden
your
haber
question of
varios ámbitos, ¿no? Y
co-responsibility,
como todos los actores de
there
este
can be several
ecosistema, creo que
environments, and like
nosotros
all stakeholders
interactuamos y
here,
nos articulamos, ¿no?
we
Desde la industria,
interact
por
and
ejemplo, para
coordinate
empezar
from
con los
the
pacientes
industry
y
to
profesionales de
collaborate
la
with
salud. Creo que
patients
ahí
and
podemos
health
estar
professionals.
juntos.
I think
Pues hay
they
un
can be
trabajo de
together,
cómo
and there's a work
transferir o traducir
um,
toda la información que se recoge
on how to
durante el
transfer,
ciclo de vida
translate the
de los
information that is
medicamentos
gathered from the
para que
life
pueda
cycle of the
llegar
medication,
de distintas
um,
maneras, ¿no? Si
so
empezamos
that
por
we
los
can get it differently.
pacientes y los usuarios,
Um,
pues el reto es cómo
and
traducir esa
patients and
información
users,
científica a un
it's how
lenguaje
to
que
translate the
sea más
scientific
entendible,
information
¿no?
to
Y
a
en
language that
eso
is
las
more
industrias
understandable.
han hecho o
And in
vienen
this
haciendo
case,
un
the
esfuerzo en lo que
industries
se
have
llama
been
la
doing an
literatura,
effort
como el
on
literacy, la enseñanza
literature
y la educación en
or
salud,
teaching
para que la
uh,
información que
so that the information that we put on the inserts or the labels on the web pages of the companies can be understood not only by the physician, because the physician is obviously the guideline of the patient, but that this information can also be more readable for the patient. And in this case, pharmaceutical companies have this effort in health literature. There are examples of companies where they have tried, and I can mention maybe, for example, Braille for labels, so that people who have vision problems can get informed on what's going on with their medication. And it's not just the information that they receive from the health professional. And if we talk also about the use of technology to be able to have better access, the industries are also moving towards the electronic inserts and medication security electronically, for that the patient can have on hand not just a sheet of paper that has been folded 16 times. It can be an insert, but it can very quickly get to the product information through safety information electronically. And if we look from the health professionals, we do this, and with them, languages pose a challenge, that it needs to be a challenge at the level of the healthcare professional, but always transmitting all the information that the health professional needs, so that they can have on hand the necessary information for decision making on what is the best treatment that could benefit the patient, so that they can learn about what the options the companies have, which can provide greater benefits, and where we can better control the risks. And this is a communication that doesn't stop. It starts from the moment that the clinical studies are being carried out and the results of these reports are communicated. And then when the products are already on the market, we have activities of education that are shared, or informative session, or publications in journals and scientific journals where we communicate this information. And I also want to move a little bit to another actor that we go very much hand in hand with patient safety, and that we share this great responsibility with, and it's with the health authorities. And with the health authorities, part of the efforts that are done from the industry, on the one hand, it's trying to improve the amount of reports. As an industry, we share a lot with our participation, for example, in this panel or in other activities. What this demonstrates is that we're interested in having both professionals and patients and users support and contribute all the possible information, so that we can, with this information, be like constantly monitoring the safety of our medications and the benefits and the risks that these medications could have. So on the one hand, it's making volumes of reports be able to grow, but not only the volumes, but also the quality. And with the authority, we've done very big efforts, and we can mention like bring on the new mechanisms of standardization of adverse events to start in many countries in Latin America. Together with the authorities, the pharmaceutical industries have started to use electronic reporting mechanisms with fields that help us have the information organized in a way that it can be more easily analyzed later. So we started to use the technologies with the electronic reports, and then we also add the use of the dictionary of terms for the report of adverse events, so that we could standardize what is the name of the report of the issue that the medication is causing so that we could all understand the same thing with the use of the dictionary. And now we are in a new phase that is not just the report, but also the dictionary so that we can all merge, like, and know what is a medication, what is a product that is causing this problem for the patient. And then this way, when we do the aggregated analysis, we can then at the end benefit with an information of greater quality for patients and healthcare professionals and authorities on how to pay attention to these effects that, as Dr. Lilian and Josue was saying, many times these are intrinsic to the beneficial action of the medication, but there's other effects that we would not like to have. And this is what we need to pay attention to so that we can communicate this in a timely manner, and we can review this so that we are always sure that the medication that the patient is using will have more benefits than risks or undesired effects, and therefore it can be the best therapy for each one of the patients that will lead them to have a better health and a better quality of life. And we can meet with this purpose that the industries have, which is guaranteeing the treatment and the mechanisms for the recovery or maintenance of health of citizens. Thank you so much, Francisco, for sharing how, from many perspectives that are so virtuous and committed and ethical in putting the patients at the center, the pharmaceutical industry takes very important actions in terms of co-responsibility. Thank you for what you have shared with us in this forum. Allow me very quickly to have a space related to this dialogue that we're having. We would love to be able to have more time to be able to talk about this and to give space to all of you wonderful experts. But however, we would like to invite you to this next round because our time is running up, so that our panelists can share a key message or a key lesson punctually on the context or the question that we ask in this second and final round of questions. The 10th anniversary of the Med Safety Week invites us not just to celebrate, but also to look back and recognize what we have learned. Along these years, we've seen how collaboration between regulators and society can mark a huge difference in terms of medication safety. That's why I would like to ask you, Edgar, what lessons learned would you highlight from this collaboration? And how has this contributed to making medications safer? Well, in this sense, for us, pharmacosurveillance is a collaborative work. We cannot see this in an isolated manner. Both the authorities as well as the professionals and the industry, we all have to work together in collaboration. This is not isolated, that it's only for some. At the end of the day, we're all included. What are we looking for? Patient safety. So we're all in this chain, from the actual patient who has to be interested in taking care of their health and doing surveillance on the medications that they're using in this case. If they have any type of effect that is unusual, they have to tell their doctor and or anybody they have access to, and we should go in down this same chain. The healthcare professional there has to determine, based on their knowledge or their expertise, if it's an adverse effect and notify it, being it to the regulating authority, or if they have contact with the pharmaceutical industry, because everybody in that chain collaborates. At the end of the day, it's a collaborative act, and it's very important to always establish the competencies of each stakeholder. In this sense, having the regulations established in the countries, the ways for communication for the reports, and this is very important. And then at the end, this is what will have an impact and make changes. It's working a lot on teaching, both for healthcare professionals, for patients, and the importance of reporting. And as Dr. Francisco was mentioning, maybe we are not going to always be able to give feedback from reports,
eventos
because
o
sometimes
cosas que
it's
son
many
conocidas
events or
públicamente.
adverse
Entonces, eso
reactions
nos
that are
interesa
known for the
más
medication. So
conocer
we're
aquellos
interested
eventos que son desconocidos, que pueden
in
ser
knowing
serios, que
about
pueden
these events. It
afectar
can be
al
unknown, it
paciente.
can be
Entonces,
serious, it can affect the
ese es el aspecto
patients.
en el que
So
tenemos que
that's the
trabajar,
aspect
¿no?
that
De
we
que
have to work on,
ese
that
conocimiento de qué es lo
this
que necesita el
knowledge
Sistema
on
Nacional
what
de
it is that the National
Farmacovigilancia en sí
Pharmacosurveillance
se
System
conozca
needs
desde el paciente, el
should be
profesional de
known
la
from the
salud y la
patient to the
industria para
healthcare
trabajar
professional
todos de la
and
mano y
the
al final
industry, so
poder
that we can
tomar
all
las
work hand
mejores
in hand and at
decisiones
the
de
end be able to
gestionar
make
esos
the
riesgos, que es
best
lo que queremos
decisions to
al
manage
final, ¿no?
these risks.
Para que el
That this is
paciente
what we
entonces
want at the end of the
pueda
day, so that the
sentirse
patients
mucho más
can
tranquilo y
feel
seguro
more at
en su
ease and
terapéutica.
safer in their therapies.
Gracias, y yo sin lugar a duda vuelvo a
Yes,
recordar esa
and
frase
I
con la
also
que
want to
empezamos con
remember
Josué,
this
y
phrase
es
that we
que
started again with
podemos
Josue,
tener una frase
and it's that
clave hoy
we can have a
después,
key
los podría
phrase
ser
today.
aliados,
It could be
aliados en
like
acción.
allies in action.
Y le agradezco por compartir esa visión desde
And I
la
want
agencia
to thank you
regulatoria,
for
porque es
sharing this vision
esencial.
from the
Todos acá
regulatory agency, because it's
representamos un
essential. All
actor
of us here
clave del
represent a
ecosistema.
key stakeholder in
Sin
this
lugar a dudas, Med
ecosystem, and
Safety Week
undoubtedly,
también
the
nos
Med Safety
invita
Week
no solo
also
a
invites us
celebrar, sino a recordar
not only
el
to
por qué y
celebrate, but
para
to
qué
remember
hacemos
the
esta
reason
misión.
why we do
Yo soy
this.
una convencida que
I
la
am completely
farmacovigilancia es
convinced
una de
that
las
pharmacosurveillance
ciencias más
is
loables que
one
podemos
of the
hacer
best
todos
sciences
alrededor
that we can
y
all
con el
do
paciente en esta
around and
ruta,
with the
en este camino.
patient
Y por
down
esa
this path.
razón yo quisiera
And
pedirte a
for
ti,
this
Jessy,
reason, I would like to
a
ask
quien
you,
realmente
Jessie,
hemos escuchado de una manera bien
who we've
interesante como este vocero de
heard
la
from
seguridad, de la investigación, de la
so many
ética,
interesting
a que
things,
nos
as a
compartas un poco
spokesperson of
cómo
ethics and
pueden
security.
entonces
Can you
las
share a
autoridades
bit of
desde tu
how authorities,
perspectiva
from
de
your
vocero de
perspective,
pacientes y
patient
pacientes, cómo pueden las
spokesperson and as a
autoridades,
patient, how
los
can
profesionales de la
authorities and
salud,
health
la industria
professionals and the
farmacéutica
pharmaceutical
ayudar a
industry
que los
help
pacientes,
the
ustedes,
patients,
nosotros,
you, us,
podamos
be able
participar
to
en el monitoreo de
participate
la seguridad de
in
los
the monitoring
medicamentos
of
y el
medication
reporte de
safety and the
reacciones
report
adversas? ¿Cómo
of
podemos
adverse reactions?
nosotros
How
ayudar?
can we help?
Bueno, lo primero
Well,
es
the first thing
que exista este mecanismo es
is
fundamental.
that having this mechanism
Se
is
está
fundamental,
conmemorando 10 años de
because
una
we're
lucha
commemorating,
que
we're
antes eran
celebrating
como
10 years of a
cosas
fight
aisladas.
that used to be
Hoy en
like
día estamos
isolated
diciendo
things. And
todos los
nowadays we're
actores
saying
somos
that all
importantes dentro
stakeholders
de
are
lo que es
important
la gran
within
estrategia, digámoslo así,
the
o el
great
gran propósito de
strategy or
hacer
the
los
great
medicamentos
purpose of
seguros.
doing medications and make them
Yo creo
safer.
que una de las cosas que es fundamental
I think that one of the
es
things
el
that's
tener
fundamental is
claro
having,
cuáles son
is
los
being
procesos
clear
o esos
on what are the
mecanismos y su
processes or the
importancia,
mechanisms
¿sí? Es claro. Lo que pasa es que
and
nosotros
their
a veces o sea,
importance.
nos acostumbramos
And
como
sometimes
que a normalizar
we
todo.
are used to
Entonces nosotros
normalizing
decimos,
everything.
si el medicamento tiene la
So we
etiqueta
say if the
que el
medication
evento
has
esperado es de uno de cada 100,
uh,
bueno,
in the
significa que
label
uno de
that
cada una persona de 100 personas le puede
one out of
presentar.
100
Pero
people can have
resulta
these
que eso no
effects,
significa que el
okay, great,
resultado
but that
final
doesn't
o el
mean that the
control o la
final
vigilancia
result or the
sobre ese
control or
medicamento
surveillance
haya
on that
terminado.
medication has
Porque es que
ended,
normalmente
because
eso se hace sobre, como lo
this
mencionaba
is
el doctor
normally done,
Francisco,
as Dr.
la
Francisco was
industria lo hace
mentioning.
sobre unos
The
ensayos
industry does
clínicos
this
con
on
una
some clinical
población
trials
que nunca
with
va a
a
ser
population that
representativa
will
a nivel
never be
mundial, aunque sea
representative worldwide,
multicéntrica, aunque
even
digan,
though it's
tenemos 2.000 personas
multicentric,
dentro
even if they say we have
dentro del
2,000
ensayo
people
clínico controlado, pues
within
nunca
the
va a
clinical
lograr el objetivo. ¿Y qué
trial, it's
puede
never going to
pasar? Y
achieve
es
the
que
objective. And what can
cuando
happen?
el
And
medicamento
it's
ya lo
that when the
tenemos nosotros
medication, we
para
already
tenerlo
have
como
it,
parte del plan de beneficios de
to have it as a
salud,
part of the health
puede
benefits
llegar a
plan,
pasar y es que
it
esa
can happen
clasificación
that
cambie
this
si los
classification can
eventos
change
están reportados.
if the events are
Puede llegar a
reported.
pasar que no
It
solamente
could
digan, no, es que
happen
no es uno
that
de cada 100,
not only
sino
that they say, no, it's
en
one
el
out of
consumo
100,
ya
but in
global
the global
resulta que son
consumption, it
5 de
turns
cada
out that
100,
it's 5
¿sí?
out of
Entonces
100.
la clasificación
So
del
the
riesgo puede cambiar y
classification
por
of
eso es
risk can
importantísimo que
change. And that's why it's
nosotros
so
no
important
normalicemos
for
las
us
cosas, que
not
lo
to
reportemos.
normalize things, for us to report
Ya
things.
hemos
And
hablado o
we have
hemos
already
escuchado
talked about, or we have heard
recientemente
uh,
los ejemplos de
from
Chile, de
the
Panamá,
examples of
donde
Chile
existen
and
estos
Panama,
mecanismos,
where
pero
they
también
have
es
these
adoptarlo en
mechanisms, but
todas las
it's also
partes. O sea,
adopting this
porque
in
es que
all
esta
parts,
información no
because this
solamente afecta a mi
information
comunidad o
not
a mi
only
población,
affects my community or
porque
my
el medicamento es
population,
de
because
uso
the
global,
medication is
¿sí?
of a
Entonces,
global
también
use.
es entender que
So it's
todos
also
los
understanding
medicamentos,
that all
sin importar su
medications,
origen, porque estos
regardless of
de
their
fábrica
origin, because
para,
this not only
para los
applies for
medicamentos de origen sintético o
medications
los
for
que nosotros
synthetic
llamamos los
origin, or
medicamentos
what we call
químicos, por decirlo
chemical
así.
medications.
También esto aplica para todos los de
This
origen
also applies
natural.
for all the
Nosotros no
natural
debemos
origin
hablar solamente de
medications.
lo
We
que es
can't only talk
químico, entonces
about
ahí está.
what is
¿Por qué le
chemical,
pongo un ejemplo?
because as an
Los
example,
bálsanos, que son
taxons that are one of the primary medications in oncology. The molecule comes from a plant. So we would say, then since it comes from a plant, it's safe. No, well, that's not the case. There are adverse events that are important and that this requires a special follow-up. So let's not normalize. And the commitment is here also. And if you want to take something from me, today, let's not normalize things and let's report everything.
Interesante, Yesid, lo que bien nos
Very
planteas,
interesting,
el hecho
Jessid.
de el normalizar en este
In terms of
contexto,
normalizing in this
sin duda alguna,
context,
no nos pone en el lugar que nos merecemos
doesn't
estar, que es un
place
lugar
us where we
más
deserve to
activo,
be,
pero sobre todo
which is a more active
participativo y
place, but more
alineado a lo que
participatory,
andamos buscando todos y
and
cada
aligned
uno
to
de los
what
que
we're
estamos en
all
este panel.
looking
Para
for.
cerrar
To
esta ronda
close this round
de reflexiones,
of
pues
reflections,
sin duda alguna, uno de los actores más
undoubtedly
importantes
one
en
of the
el
most
control de la
important
seguridad de
actors in the
medicamentos
process of
y que puede
medication
tener
safety,
un gran
and that can
potencial de
have a great
transformación
potential
es
for
el sitio de atención
transformation,
médica,
is the
que
place for
usualmente
medical
puede ser
care
un consultorio
that is
o
usually
inclusive en
an
un contexto
office
más
or
robusto, un
even in a more
hospital.
robust context,
Y
a
no solo
hospital.
como una institución, sino
Not
como un
just as an
espacio
institution,
donde
but as a
confluyen
space
las decisiones clínicas,
where
las
the clinical
experiencias de los
decisions and the
pacientes y
experiences of
además
the
estas
patients come together.
oportunidades de
Also,
poder
these
seguir compitiendo
opportunities to
en
be
favor
able
de
to
la
keep
seguridad de los
building in
pacientes.
favor of
Por
patient
ello, en
security
este
or
marco del
patient
Med Safety
safety.
Week, en donde
Therefore, in this
su
framework of Med
lema para
Safety Week, where
este
the
10º aniversario
logo,
es
where the
todos
slogan
podemos
is
ayudar a
we
que los
can all
medicamentos
help
sean más
medications
seguros,
be safer,
quisiera cerrar esta mesa de reflexión con la
I would
participación
like to close
de
this
Lili
reflection with the
haciendo el
participation of
siguiente planteamiento.
Lily with the following
¿Cómo pueden
statement.
los hospitales
How
convertirse
can
en aliados
hospitals
estratégicos
become
para hacer
strategic
realidad este
allies
compromiso
to
colectivo?
make this collective commitment a
Gracias, Albert.
reality?
Y pues
Thank you so
en
much,
aras
Josue.
del tiempo,
And in the best
seré
interest of
breve en esta
time,
respuesta,
I will
pero
be
creo que con
very
mensajes
brief,
claves,
but
como
I think that with
mencionaste,
key
¿no?
messages
Una de
like
las
what you mentioned.
principales cosas
One
que
of
creo
the main
que
things that
tenemos
I think
que
we
trabajar,
have to
¿no? A
work
10
on
años del Med Safety Week es
in the
que
10th
la
anniversary of the
Jornada
Med
Nacional de
Safety Week
Medicamentos,
is
no,
that
si bien nos ha
this
visibilizado y ha
Medication Safety
identificado
Week,
la
even though it has
importancia para incluirnos a
visibilized and
todos,
visibilized the
pues no
importance to
solamente es una
include all of
semana,
us,
sino lo
it's
podemos
not
hacer
just a
día
week.
con
We
día.
can do this
Ajá.
every day.
Entonces,
We should
lo
do this
primero
every
es
day.
que
So the first
este
thing
reto de incluir a
is
la
that
farmacovigilancia
this
dentro de
challenge of
la
including
práctica clínica,
pharmacosurveillance within the
dejarlo de ver
clinical
como un
practice
proceso
and not seeing this
administrativo y
as an
más como
administrative
un proceso
process
dentro de la
and
clínica. Es
more as a
decir, que
process
así
within
como un médico
the
escribe la
clinical
historia
practice. So,
clínica con los
as a
antecedentes
physician describes
familiares y todo
the
esto, así
clinical
al final del
history
tratamiento, pues
at the
se
end of the
puede
treatment,
poner, ¿no? De, oye, el
they should
paciente
also
presentó
state, okay, the
algún
patient
efecto adverso
presented
o no a los
an adverse effect
medicamentos.
or not to
Esto
medications.
se puede hacer a nivel de políticas institucionales en la inclusión de
And for
el
institutional
reporte a
policies in the
través de los
inclusion of the
protocolos de
report
tratamiento o
through
incluso de
the
las guías de práctica
treatment
clínica,
protocols
¿no?
or
De,
even the
sabes
clinical
que
practice
una
guidelines.
parte esencial
Like
de todo es
an
monitorear a
essential
tu
part
paciente,
is
pero
monitoring the
además
patient, but also
notificar, ¿no? O sea, notifica todo
notifying.
esto para que
They notify
tengamos
all
un margen de
this
acciones. Y creo que
to
eso
have a
podría
framework
dar
action.
el paso de ser visto como una parte administrativa
And
a ser
this
ya visto
should
como una
take us
parte
to a
netamente
step
clínica, porque eso es lo que
from
buscamos con
going from an administrative
farmacovigilancia.
part to a
Otra
clinical part, because
parte
that's
es
what we're
que
looking for
estos
with
programas de
pharmacosurveillance. And
capacitación
another
y
part
de
is that these training
concientización
programs and
incluyan también
awareness
a los
creation programs also
pacientes, a los
include the
familiares y a los
patients, the family
cuidadores.
members,
No
and the
siempre nos dirigimos
caretakers.
a los
We
pacientes,
always
sin
talk to the
embargo, por
patients.
ejemplo, yo trabajo en
However,
un hospital
I
pediátrico.
work
Entonces,
at
dirigirse a
a
un paciente
pediatric
pediátrico, pues
hospital,
hay
so
que
going
bajar el
to go
lenguaje y
to
hay
a
que hacerlo
pediatric
con
to talk to a
muñequitos y hay que
pediatric
hacerlo con
patient, we
todo.
have to bring our language
Pero
down
hay
and
algo
use
muy
like
importante
dolls and
que es
figures. But there's
el
something that's
familiar,
very
que muchas
important, and it's
veces
a
no es el
family
familiar, sino
member.
es un
Many
cuidador,
times it's not the
ajá,
family member,
el
but a
cual, al
caretaker
cual se le tiene que incluir en
that
toda esta información
has to be
para que pueda
included in
tomar
all
las
of this
mejores
information so
decisiones.
that they can
Un
make the
paciente,
best
un
decisions
familiar y un
possible.
cuidador
A
informado
patient, a
son
family, and a caretaker that are
esenciales en nuestro
informed are
sistema porque van a
essential in our
detectar
system because they're going to
todos estos
detect
síntomas de alarma de
all
manera,
of these warning symptoms
previa, ¿no? A que se te complique.
previously before the
Otra es que van a
complications. And
mejorar la adherencia a
another
los
thing is that they
tratamientos
will
y
improve
otra
the
muy
adherence to
importante que nos
medication.
va
And
a
another
aumentar la
thing
calidad de la
is that this will
información de
increase the
estos reportes.
quality of the
Entonces, es
information
muy
of these
importante
reports.
que los programas de capacitación
So it's
y
very
de
important that
concientización
the
queden
training and
con
awareness
otros
programs
actores que no sean
have
solo
other
profesionales. Y
stakeholders
aquí
that
hago
are
un
not just
paréntesis, ¿no?
professionals. And
Siempre
here I want
hablamos
to do
de
this parenthesis. We
farmacovigilancia,
always
él
talk
habla de
about
farmacovigilancia, que
the person
farmacovigilancia
from
es importante.
pharmacosurveillance talks
Tenemos
and mentions that this is important,
estar
but
en otros foros
We have to be at other forums and we have to be in other media so that we can also have a maximum scope where we all have the power to make medications safer. And the final thing, and I want to emphasize on the culture of co-responsibility. It's not that you have to do this, you have to do that, and I don't. This is a culture of co-responsibility. What can we work on in a multidisciplinary manner through pharmacosurveillance committees, through different environmental forums, where we can establish medication safety as a priority in the institutional speech and the speech for patient care and quality. So this is what we all have to do. It's a co-responsibility, and from there, we all have this role of being communicators on medication safety. This is the example. The Med Safety Week adds on to the health institutions through a campaign, but this campaign is not just directed as compliance, but also to reach the objective of creating awareness on the final population. Once again, I absolutely follow these messages. We have to do something so that we can all start speaking like you and that we can have this consciousness and this awareness. I think that all the stakeholders of the pharmacosurveillance ecosystem have a legitimate purpose and function, and even more so the healthcare professionals who are facing the patients. This is not just for the regulatory agencies, because this I also recognize the efforts in Latin America, and this is amazing. Sometimes we have unconscious biases, and I also recognize that the patients are spokespersons. And Jessie, very quickly, I will tell you, Jessie told me, Diana, you know what I would like you to say that the patient is on the table, not at the center. Just put it on the table. And this made me, like, this triggered something. Wow, this is true. We always say that, like, a lot of our roles say we're going to do strategies, thinking and putting at the patient at the center. And Jessie told me, just sit us at the table. So the pharmaceutical industry, undoubtedly, we have a lot of stories in common, but I think that in this science we have a role in participation that is so important. This is where we should start establish trust bridges from. I have to close the panel, but I want to leave a question for Francisco, because thanking to the 155 people who have been here, and many of you have stayed here to listen. And I think we could stay here forever. But Francisco, there's a question that's very important about the exercise that we must guarantee representing the pharmaceutical industry. And the colleague, I will paraphrase the question, and I wanted to be more guiding for Francisco. And it's that undoubtedly us, and I mention us because I also represent the pharmaceutical industry sector, and we receive reports of adverse events and adverse reactions to medications, Francisco. And this, she's stating a very interesting scenario, and it's when doing the reports, I want to contextualize the holder of the healthcare record. Many of the holders present that it's difficult to share the reports or to do follow-up on the patient directly. And it's a challenge because I think that you and I agree on something, and it's a protection of data and the role of the industry. And one of the questions is, look, the pharmaceutical industry, like, what strategies does it take? What actions does it do to understand this, which is a challenge of data protection? In the report of the event, capturing the event, but also doing direct follow-up on the patient. I tried to paraphrase the question, Francisco, but I know you're the most, like, the best actor to respond to this situation, this real situation presented by our colleague Norma on the chat.
gracias, Diana, gracias,
Yes,
Norma,
thank
por
you,
la
Diana.
pregunta.
Thank you, Norma, for your question. I think it can be associated a little bit to the fact sometimes that there's like this prudence of the exercise of the industry and the respect for people and authorities, of giving health professionals the position that they have as this mediating agent between the medication and the user. Because trying to maintain this respect, we don't want to feel that we want to have an influence on patients constantly, or that we want to have these direct interactions, and sometimes we look for them with the professionals. However, I have to say that I can speak for the industries that we represent, that the follow-up with patients is immersed in the good practices of pharmacosurveillance and the international recommendations, and they are incorporated by the company. So when we receive a report for the first time, we try as much as possible to get additional information, because we want to know the detail of what happened. We want to know how it happened, when it happened, what else was the patient taking. So maintaining this prudence, or this care for the good norms of confidentiality and information management. I want to tell Norma that the industries, at least the ones that are represented in FIFARMA, and I know that's the case with many others, try to have this dialogue with the patient to obtain as much information as possible. And healthcare professionals, of course, are a source of information that we go to, but if we have data of the patients and we have the authorization to do this, we try to get to them, and not only once, but maybe 2 or 3 times. I said that you were the right person to answer this question, and thank you, Norma. I don't know, doctor, if you agree or not, but this gives us an interesting opportunity with Dr. Lilia of having a session at some point talking about this data restrictions, and that it's something that hurts us all, not just the patient, the healthcare professional, the regulatory agency, but the entire pharmacosurveillance system. Josue, I think we could stay, those of us who are connected, we just want to ask for 2 minutes of your time and your patience, because we have to say thank you. Thank you for recognizing Dr. Liliana. I am a follower of everything that you're teaching and you're doing. We appreciate, we value this in my country as well. This is a movement that needs to be moving forward. And Jessie, we have the honor to be listening to you from this heartfelt experience and from living in. You gave examples of things that happen to us every day in products that have a biological origin. And this is true, or that have an origin that we have to stop thinking about the fact that it's normal. We have to report everything. Let's not normalize this. It's part of the exercise. Dr. Edgar, I heard you talk about this effort a few weeks back of what the agency does, and I take home this message so much more today. I want to thank you on behalf of the Federation in Latin America, because what you're saying of putting a language in a format to be friendlier as a report for the patients means making the regulatory agency capture directly the information of who is actually having the event. I thank you, and to my esteemed Francisco Sierra, thank you, because I know that your experience and this knowledge undoubtedly on the industry makes us also be able to represent this legitimate task. And I would like to thank you all. Like, it's a panel that I would like to take 20 hours, 20 more hours. Josue, what do you take back from these great panelists? Well, Diana, I think that basically everything has been said. However, I would just like to add one final reflection of such interesting and humane panel. This 10th anniversary of the Med Safety Week has shown us that more than talking about systems, we talk about human commitment, because pharmacosurveillance is not just a regulatory tool. It's a way of caring for and protecting and listening. And I'm sure that the people who work in pharmacosurveillance, we know that in every collaboration gesture, in every conversation related to medication safety, in each report of event or suspicion of adverse effect, we're telling the patients Your
vida
health
nos
matters.
importa. Así es
Your
que
life
gracias,
matters.
gracias por esta
So
invitación y
thank you
encantado de
so
poder
much for this
conectar con todos
invitation, and I'm
ustedes.
so happy to have connected with all of you.
Diego Salas, queremos invitarte
Diego
en el
Salas, we want to
cierre.
invite you to close.
Por favor, únanse al Med Safety Week. FIFARMA
Please join
está
the Med Safety
compartiendo
Week.
esto
FIFARMA
comprometido
is
con
sharing this,
EMC. Todas sus
committed with
reflexiones en nuestras
EMC,
redes son
and all
importantes
your
y solo
reflections in
quiero
our
decir
socials are
gracias por
important. And I
poner
just
al
want to say,
paciente en la
Jesse,
mesa.
thank you for
Gracias
putting
por
the
unirte al
patient
Med Safety Week
at
desde
the
la
table.
Federación, al doctor
Thank
Edgar,
you for
gracias
joining the
doctor por
Med
venir,
Safety Week from
desde
the
la cara de la
Federation, and Dr.
universidad, la
Edgar,
doctora
thank you so much
Liliana
for
desde los
coming
hospitales
from the
y la
agency, and
academia,
Dr.
a
Liliana from
Francisco.
hospitals and
Diego, no
academia, and
sé
Francisco.
cómo
Diego,
cierras y qué te
I don't
llevas
know
de
how you
esta
want to
primera
close and
edición.
what you
Nos
take home
anticipamos
from
al
this
aniversario en
uh,
FIFARMA y las
first
próximas
part.
semanas
We are
estaremos
anticipating to the
estallando esto
anniversary
en
at
el Med
Vifarma,
Safety Week.
and next week this
Yo estoy
Med Safety Week will be
extremadamente
blowing up.
orgulloso
I
y
am
contento
so
de ver cómo
happy
estamos
and
creando
proud
región, ¿sí?
to see how
Cómo
we're creating the
continuamos
region
uniendo
and how we
esfuerzos.
keep
Me caló mucho también el
bringing
mensaje
together efforts.
de
And
decía,
Jesit's
tenemos que
message
dejar de
really touched me,
decir,
where he said,
pongamos al
we have
paciente
to
en el
stop
centro
saying
y sentémoslo en la
put
mesa.
the
Yo en
patient at the
muchas
center. Let's
ocasiones es
sit them
una
at the
crítica que he
table. On
hecho
many
a
occasions,
todos,
this
y
is
me
a
incluyo los que
criticism that I've
trabajamos en el
done
sector salud, es que
because
a veces
and I
hablamos del
include myself. We always
paciente
talk about the
como si el
patients
paciente estuviera allá
as
y
if the
nosotros
patients weren't
estuviéramos
there and
aquí.
we were here.
Estamos hablando de personas.
We're talking about
Nosotros,
people.
en algún momento de
We,
nuestra
at some
vida,
point of our
vamos a
lives,
ser paciente
are going
o
to be
somos
patients, or
pacientes
we are
también, o
patients as
tenemos a
well,
alguna persona muy allegada a
or we
nosotros
have
que
a
es
loved
paciente.
one who
Entonces,
is a patient.
hay necesidades
So
ilimitables,
there
como
are
lo
unlimited
mencionaba la
needs,
doctora Liliana,
and Dr.
pero también
Liliana
hay
was mentioning
un
this.
compromiso
But
de
there's
muchísimas
also another
personas por
commitment
continuar avanzando
of
hacia
many
sistemas de
people to
salud
continue advancing
más
towards health
resilientes y
systems that
hacia
are more
sistemas de salud
resilient
más
and to health
enfocados
systems that are
en
more
las personas.
focused
Tenemos
on
muchos retos,
people.
pero yo
We
siempre he
have many
sido
challenges,
muy
but I've
positivo y
always
prefiero ver las
been very positive,
oportunidades
and I'd
que
rather look
tenemos
at
en
the
el camino,
opportunities that we have
oportunidades
along
que
the way,
construimos
opportunities
con
that
el
we
esfuerzo,
created
el
with the
talento, el
effort and the
conocimiento
talent
y
and the
la pasión
knowledge
de los
and the
más de 150
passion
personas que
of
nos han
the over
acompañado en este
150
webinar
people who
y de
have
nuestros
supported us at this
distinguidos
webinar and
panelistas.
our dear panelists. We
Construyendo
continue,
región,
let's continue
continuemos trabajando
building
en
a
conjunto y
region,
queremos hacerles unas
working
últimas
together,
preguntas.
and we want
Por
to
ejemplo, ¿cuál
ask
es la
some
idea
final
principal
questions.
que
For
te llevas de
example,
este evento?
what is the
Algunos
main
mencionan
idea of this
involucración.
event? And
Todos
some
somos parte de la
mention
seguridad de los
involvement,
pacientes,
and we're all
unir
part of
esfuerzos,
patient
la importancia de la
safety, bringing efforts together,
farmacovigilancia,
the importance
el
of
papel de cada uno de
pharmacosurveillance,
los actores,
the role of
aliados en
each one
acción,
of
que
these
esto creo
stakeholders,
que en
allies
tiempo de
in
la
action.
universidad como un hashtag que podemos usar
And this
para
it
futuras
can work as a
ocasiones.
hashtag for
Todos los
future
eventos son
occasions.
importantes.
All events are
Tal vez nos pasamos a
important.
la siguiente
If
pregunta,
we
por
also go to
favor.
the next question, please.
Siguiente pregunta para nuestros participantes o asistentes es, ¿cuál es la
The
idea
next question is,
principal
what
que
is the
te
main
llevas de este
idea
evento? Bueno,
that you
involucración,
take home
aliados en
from
acción,
this event,
conocimiento.
involvement, and allies
Queremos
in
preguntarles
action?
también si han aprendido
And we
algo
also
nuevo.
want to ask you if you've
Confirmen
learned
que
something
sí, por
new.
supuesto, creo
They
que
said
todos
yes,
los
of
días
course.
uno
And I
aprende
think
algo
that
nuevo
every
y en la
day we
medida en la
learn
que uno
something
tiene la
new.
oportunidad de
And
escuchar
as we have the
otros
opportunity to listen
otras
to other
percepciones,
voices
otros puntos de
and
vista,
other
el
perceptions,
conocimiento se enriquece y creo que eso es la farmacovigilancia,
and
escuchar
they
las
enrich the
posiciones de la
knowledge,
industria, escuchar las posiciones de la autoridad reguladora, de los
and listening
profesionales de
to
salud,
the
de los pacientes y
positions
personas
of the
que han
regulatory
tenido
entities and the
beneficios.
health
De nuevo, en
professionals
nombre
and
de
the
FIFARMA, la
patients.
Federación
And once
Latinoamericana de
again,
la
on
Industria
behalf of
Farmacéutica,
FIFARMA,
hacemos nuestro
the Latin American
compromiso
Federation of
público
the
por continuar
pharmaceutical
promoviendo
industry,
una
we make our
cultura de
commitment
seguridad de los
public to keep
medicamentos en América
promoting a
Latina
culture of
y de
medication
continuar
safety in Latin
conectando,
America, and
continuar
to keep
conectando diferentes voces
connecting
y
different
diferentes
voices and
aliados
different
en un objetivo
allies
común
in
y
a
es
common
más y
goal,
mejor
and
salud
it's
para todos los
more and greater
habitantes
health
de
for
América
everyone
Latina. Que no
in
importa el
Latin
lugar donde
America.
vivamos,
No
el
matter
país o la
where
edad
we
donde
live, the
vivamos,
country or the
sigamos
area,
luchando porque
we
todos
can
tengamos las
keep
mismas oportunidades,
trying to
el
give
mismo acceso,
everyone the
porque la
same
cultura
opportunities
de
and the same
seguridad de los
access, because
medicamentos es
the culture
fundamental.
of medication
Gracias por la
safety should
generosidad de su
keep
tiempo.
being a priority.
Gracias a
Thank you for
nuestros
your time, for your
panelistas por
generosity.
compartir con
Thank you for
nosotros
the
sus
panelists for
experiencias y
sharing
sigamos
the
avanzando y sigamos
experiences.
construyendo
And let's
región
keep
y
moving
les deseamos
forward and
todos un
building this
excelente
region.
resto de
And
webinar.
we wish you all an excellent, great session.